Committee of the Whole is back in order. Today we are going to resume the discussion on Bill 74 as we have for the last few days. And in order to try and facilitate the discussion and expedite the process as was requested by one of the members, we are going to, as much as possible, try to stay on topic. We have the representative of the Guam Memorial Hospital officials here, and they will be answering any questions. We are now on Section 4, Guam Memorial Hospital Authority, Pharmaceuticals Fund Appropriations. Senator Frank Blas, Jr.
Thank you, Mr. Chair. And good morning to the panel. Thank you for coming out. One of the very major concerns that I got here, and we'll throw up Section 2, Guam Memorial Authority Pharmaceuticals Fund Appropriation. And in the Act 28-150 gave you $10,062,795, and now it's being reduced to $9,811,225. Concern that I've got here is that the amount to be provided to the pharmaceutical fund, isn't it not codified with regards to the amount that is supposed to be provided to you based on GRT?
Yes, it is, Senator. It's 6.19% of the GRT.
Okay. So, and based at 6.19, and we're working with a anticipated, and this is up for, again, this is still under consideration, up for discussion, over about $159 million, the GRT. Have you done the quick math, and as far as how much this is supposed to be, as opposed to how much it's proposed to be?
Yes, Senator. The quick math is that 6.19% of 159 million is 9,875,591.
And that's okay. And so that's okay. As proposed, we're looking at a $251,570 reduction. What's it supposed to be if it was to stay with the 6.19%?
It should be. Then the cut should be about $64,000 less. In other words, if we're going to follow the codified Public Law 28150, it should be higher here by about $64,000. The reduction should be slightly higher.
Mr. Chair, I recognize that it's the the ruling of this body that we're not supposed to make any motions with regards to an increase. With regards to the reductions, I just need to point this out here. Recognizing that it is codified, it is in 28150, as far as what the amounts are supposed to be based on, the amounts, the percentage taken from the GRT, and in that recognition and staying within the boundaries, staying within lines, I need to bring that point up. Okay. Peter John, recognizing this, okay, and let's just for the sake of discussion here, that nothing has changed here, and that you do for the pharmaceutical fund only, that you are going to realize a $251,570 reduction in that appropriation. Can you live with that reduction?
Senator, what the hospital would do is, again, we would just basically rev up our in-house collection efforts. We've been doing that all along, but if there is a reduction, then we need to make sure that we pick up our efforts. We will continue to refer accounts to Department of Revenue and Taxation for garnishment, and we continue to work with patients who come in to make the appropriate payment arrangements on their bills. So we will continue to be aggressive in our efforts, collection efforts.
Yeah, how much in collections do you have outstanding?
Our gross AR right now for the hospital is $77 million.
Okay, how much do you anticipate that you can realistically collect this fiscal year?
Well, year to date, from October to February, we've already collected $49 million.
That's pretty good. 49 million, and you got 77 million left.
Well, yeah, yes.
I applaud you for that. That's pretty aggressive, and and at the rate you're going, okay, that's pretty good. And Mr. Chair, for the purposes of understanding here, we're just going to be talking about the pharmaceutical fund first, or we're going to talk about also the operations appropriation.
As the GMH officials are here, it makes sense to go ahead and address both sections. If you have any questions on either section 4 or section 5, specifically to GMH, go ahead and ask those questions now.
Okay. So, Peter John, I'm going to ask the same question with regards to the operations appropriation. Your operations appropriation there's this proposal to reduce it by about $91,000. What is that going to mean to the operations?
Again, Senator, we would continue to exert our efforts in terms of our collections to make sure that we can offset any reductions that may happen to the hospital.
Okay. Do you have any vacancies right now in the hospital?
Yes, we do, Senator. Sir, we have vacant positions. Our positions are actually funded through our revenues, our collections.
Okay.
None of the appropriations that the hospital is slated to receive, either the pharmaceutical fund, that's dedicated specifically to the purchase of medications, medical supplies, blood products, medical equipment. Those are what it's reserved for. The $3.6 million subsidy that was for operations has been identified for contractual services. So there are no positions that are funded through the general fund by, for the hospital.
Okay. Mr. Chair, thank you very much. Thank you, Peter.
Thank you. Senator Wonpat?
Thank you, Mr. Chairman. Peter John, I know that the pharmaceutical funds are strictly for specific drugs, medical supplies, and all that, and you're going to aggressively work to bring in the monies, the revenues, collect and revenues, so that then you'll be able to take care of other things. This dollar amount cut, though, which is very specific, and then you're saying that the other revenues from your collections will go to contracts and positions and all that. How are you going to make up for this, the difference for pharmaceuticals then? Or are you just going to leave it as is, the cut as is? Or are you going to take monies from your collections to supplement then the loss?
Yes, Senator. Also, to make up for this loss in the pharmaceutical fund of about $251,000, the governor's office has been very kind to us in allowing us to use compact impact funds to pay for pharmaceuticals and other medical equipment products. So we really feel that we would prefer that the reduction were not there, but the fact that it is there and it's being proposed, we feel that we can live with this reduction and not it will just be that small amount difference. I wanted to point out one other thing that Peter John, to support Peter John's contention earlier, is that we take those patients, clients who are indigent, and we have employees at the hospital who go through the process to see if we can make them qualified for Medicaid and MIP. And that program has been working well to try to get assistance for those patients, as well as helping the hospital to collect at least something from those indigent patients.
What is the dollar amount that you're receiving for compact impact, specifically for pharmaceuticals then?
Approximately $4 million, Senator.
And is the entire amount to be used for pharmaceutical or other
for pharmaceuticals? Your question was for pharmaceuticals. The total
million
amount we get from compact impact is about $6.2 million.
Okay, and you're authorized by the governor to use $4 million for pharmaceuticals?
For pharmaceuticals, yes, ma'am.
In addition to the $9,811,000.
Yes, ma'am.
Okay, so have you been receiving the required 6.19% each month from gross receipt tax?
For 07 compact impact, we just had meetings early this morning to see what we need to do to draw down these monies as soon as possible, so that it's the governor's wish to make sure that we use Compact Impact to pay vendors, and also to pay vendors for pharmaceutical vendors, as well as those medical equipment vendors that have installed. Specifically, one vendor, we owe about $1.2 million, the balance of our CAT scan and angio suite equipment.
I understand that you have an MOU with mental health in ordering medical drugs and other things, and they've indicated a savings for them by doing the bulk order. What is the savings on your part as well?
Senator, we're developing that MOU with mental health. We've already had some meetings with them to discuss the parameters, for the MOU. Historically, the hospital has done ordering for mental health in the past, and so it's just a matter of setting it back up again. Essentially, we will become a vendor for mental health, and so we will be then sending them the billing. So we haven't started that process yet, but we are working on developing the MOU and then, going through that, setting up the accounts and things like that.
Oh, okay. I didn't realize that you guys can be the vendors. So, will there be, like, you have an idea if you're going to think about doing the MOU, that you must have an idea of some type of savings? Then I know they're going to realize some, but would the hospital be realizing a savings as well?
One of the vendors that we currently work with, ma'am, with regards to pharmaceuticals is PerryPoint, and PerryPoint is the federal government's wholesaler, basically, for pharmaceutical supplies. And when I was at Public Health, we weren't able to go through PerryPoint because of the government of Guam's payment history. The hospital has been able to maintain its ability to pay PerryPoint, and so we've been able to continuously order from them, and so they give us a pretty good discount. We would just need to take a look at what they would need, do an analysis of what their needs are, whether or not we can get it from PerryPoint through that bulk purchasing, because there are going to be some medications that will be common to mental health and to the hospital, and the other ones that are specific to mental health, we would need to do that analysis.
On Section 3, where there's going to be a reduction of $91,000, how are you going to? How are you going to manage with less 91,000? Would that then again be from revenues collected?
It would be that.
Okay, and what is the balance then of the unexpended balance here that's appropriated to GMH, the $7.8 million?
That is the advance appropriation authority that the hospital has, ma'am, that was given by the legislature in FY06, and what the legislature approved for this year was to allow us to continue that authority, to continue our procurement process for that.
So do you have a balance there now? What is it?
We've actually encumbered pretty much almost the whole amount of 7.8, but until the invoices start coming in, then we need to do the payments to them.
Thank you, Mr. Chairman.
Thank you. Senator Calvo, you're recognized.
Okay, thank you very much, Mr. Chair. Mr. Chair, again, the chairman of Oversight over Healthcare did bring up an interesting note earlier, and I walked into the gallery as some of the issues in regards to the de-appropriation from $10,062,795 to $9,811,225. And if you'll note on 28-150, in the section 26208, there is a creation of the Guam Memorial Hospital Authority Pharmaceuticals Fund. And again, with the Pharmaceuticals Fund, if you peg it at the 6.19%, and with the new numbers that have been provided on gross receipts tax collections, you see there's going to be there's going to be a difference of about $64,000 between what is indicated in the Guam Code on 26208 and, of course, what we have in these revisions. In fact, I'm not too sure as we move along, even if this thing is ratified, if the intent of the administration to use a greater percentage of the GRT for operations, I'm not too sure whether there is a corresponding appropriation that would account for this difference. And in fact, that's one question. I'm going to ask you that one question, and then the next question is obviously we have the gross receipts tax amnesty, and that's still considered part of revenues. So again, going back to 26208, if you were to add that $12 million in gross receipts tax amnesty as revenues for gross receipts tax, obviously the imbalance grows even further, and then with that, is that accounted for on from the administration standpoint in an appropriation authority for operations? So again, I have that comments and then maybe a question to the administration.
Thank you, Senator. As Wilfred had pointed out, that the governor has earmarked a large percentage of compact money to make up the difference on the pharmaceutical costs. From a policy standpoint, the decision was made to apply the 2.5% reduction in all general fund obligations across all of the appropriations. However, we have the governor has used his transfer authority, and he's used other funding sources to continue to support the hospital's needs throughout his first term and even now. I mean, we've, as Wilfred also pointed out, we do push a great deal of our MIP and Medicaid funding as well over to the hospital to augment those non-payers that continue to build up at the hospital.
And this may, by the way, this may all be just a bookkeeping issue, but again, if you take a look at 26208, there is a creation of a fund, and within the so automatically we have 6.19% of gross receipts tax collections going into this Guam Memorial Hospital Authority Pharmaceuticals Fund. And again, help me. I haven't gone in detail into the rest of the bill, but what if there is an imbalance between gross receipts tax collections and the appropriation that has been set forth from the Guam Memorial Hospital Authority Pharmaceuticals Fund? If there is an imbalance, in order for it to be used for another purpose, there has to be an appropriation. Again, there may be senators here that have had more experience than I on government accounting, but with Section 1 of 28-150 and with the amendments that were made to 26208 based on Section 1 of 28150, then what's going to occur, and that's what I'm just making. I'm going to ask for, maybe you can help me on this. If we have this revision on the numbers on gross receipts tax collections, and with these revisions on gross receipts tax collections, you have the Guam Code, and with the Guam Code, it sets forth that a certain percentage will go towards this Guam Memorial Hospital Authority Pharmaceuticals Fund. Has that been taken into account? And is there, with what I see as an imbalance now, with whatever that difference is there the necessary mechanisms to make an appropriation for operations? And it's strictly, this is something strictly mechanical, and I'm not too sure whether it's been accounted for. And also, again, gross receipts tax amnesty, again, it is revenue, and it is gross receipts tax. So again, obviously, if you take that into consideration as well and add that to the total sums, then if you take into account 26208, then again there will be these monies. 6.19% of the totality would be first placed into this pharmaceuticals fund. And so again, that's just a comment, and I don't know whether it's already been taken into account in the other portions of the bill. I don't think I've seen it, but if not, there may be an issue, and we may have to come back for some sort of corrective language.
I'll verify with our fiscal team, sir.
Senator Pinko?
Thank you, Mr. Chairman. I'm sort of very much concerned, Mr. Chairman, regarding the amount of appropriation that's going to GMH, and simply because, of course, I had an experience with my wife, for example, 2 weeks ago, or less than a week ago, Friday, went up there, and the entire ER room is completely full, and patients were all over the place, on the hallway, name it, and some of them kept waiting. And the other thing is that the entire rooms, available upstairs is nil. No rooms available in the inn. And the concern I have is, of course, regarding the treatment of people that are coming in on emergency continuously, that are in need also to be admitted. And any amount that we are talking about in terms of reduction definitely would have an impact. And so what are you guys doing now to mitigate this, or to address these problems that we have? I know full well that GMH is acting like a county hospital, which is the way it is, right? It's a county hospital, and no county hospital in the United States ever make any profit, or it's from hand to mouth. They take care of the indigent people within the area. They have to be treated. But knowing all of this, and we've been going through this exercise for many years now, what is there any way other than the compact impact that we have to sort of take care of the balances that needs to be done, and the improvement that needs to be taken care of up at GMH?
Thank you, Senator. Several things that we are doing, as Mr. Afflewy had pointed out. The hospital historically, as you said, takes care of indigent patients, and generally those are the folks that don't have the ability to pay. The hospital has about 25% of our population that are in the self-pay category, and a significant number of them are indigent. And so through our staff's efforts, we're working to try to see if they are able to qualify for the Medicaid or the MIP program, as Mr. Afflewy said, to make sure that we can recoup some of our costs back in providing services to the patients. The situation where the hospital is full, just last week and part of this week, we were really full. I mean, as you said, we had patients in the hallway in the emergency room, and if they're not able to get admitted into the intensive care unit, depending on the level of care that they need, then they're kept in the emergency room, because the nurses there have additional skills, higher level skills, to be able to continue to monitor the patients, and we want to make sure that the patients get that level of care that they need.
How long have this been happening, the overcrowding up there? I understand it's not only 2 weeks, it's now going months.
Well, this morning, sir, we were actually at a patient census of 159, which is manageable. We had some beds that were available. There was one patient waiting in the emergency room for an ICU bed, but our ICU was full. We have 6 patients in the intensive care unit. We have the capacity to open up 2 more beds, but we need the staff for that. And so the nursing department is working on pulling some of the other nurses who have the critical care skills to be able to provide the coverage in the intensive care unit, so we can open up the 2 additional beds. It ebbs and it flows, Mr. Speaker. There are weeks and days when we're very busy, and there are days when we get told that the census is 140, 150, and we're all like, that's a nice number. But It's hard to say, and the types of illnesses that patients are coming in for, it varies. It varies. There's some with heart conditions, some with more chronic types of situations, and the other emergencies that do happen.
Is there any agreement that you have with the Naval Hospital right now to accommodate when a situation like this happens?
What happens with the Naval Hospital, sir, is that if there is an emergency out in the community and they are the closest facility, they will accept that patient, to make sure that the patient is stabilized. But then as soon as possible, they call us to try to transfer that patient back over to the hospital. And, if we're not able to accept them, then I believe they maintain them. But, the agreement is to try to get them. The current capacity of the Naval Hospital is not it's not set at our level. They have a much, much lower bed capacity right now, although they obviously have the ability to ramp it up in the event that they need to. They have resources that they can call in on to come in and supplement what they currently have. We are also, Mr. Speaker, we've actually started discussions with GETCA on looking at how we can expand our hospital. During last year when Speaker Forbes had his roundtables and the health issue came up, we started talking about expanding the hospital, maybe moving the emergency room where it is right now. It's back at the cliff, and it's a very small area with very little room to expand it, really, to look at some financing to be able for us to move it around to the front where we can actually expand that capacity. And then concurrently, with that, also to take a look at increasing our bed capacity as well.
Yes. Well, yeah, we need to Peter, John, we need to definitely address this. And I know it's critical time in terms of where we are, but when you're sick, and
Yes,
you have to have a doctor to take care of you. And so let me ask you, with the coming of the military here, are you addressing this thing too with the people from the transitional office?
The Civilian Military Task Force?
Yes.
There is a health subcommittee, and that is one of the things that that will be discussed as we move forward
Yeah, but you have it, you quantify this though, because right now we're talking about not only the impact of the freely associated states, also where the impact it will bring, the 8,000 and 1,000 8,000 Marines, 1,000 Air Force, several thousand from the Navy. So we're talking a good amount of number of people that will be here.
Yes, sir.
And it's not them that I'm worried about. I'm worried about those people, the ancillary group that will come and support these people that are not eligible to use the Naval Hospital.
Yes, sir.
And so you talk about impact. It's going to greatly impact. And we're talking about 4 years from now. I'm not talking about now. And that's the reason why that is absolutely necessary that this has to be addressed. And this is one of the priority, with those, with the military talk.
Yes,
In terms of the need to expand the hospital itself. Okay, just one more thing. The withholding tax is, are you up to date to that, as far as the payment of that? And the retirement?
We are current with the retirement, sir, and what we've been doing, we do owe some money to revenue and tax, and we will be making that payment.
And we're talking about how much?
Mr. Speaker, we've, within the past month, I can't give you the exact date, what we have agreed with Revenue Tax and DOA is to settle up every quarter. So per quarter, we accumulate up to about around $900,000 of it. So what we do every quarter is exchange assets, exchange checks, and that's how we settle up with our withholding.
I don't
payments.
understand what you mean by exchange check.
Well, we settle up and pay our withholding every quarter within 3 months. And when we accumulate about $900,000 worth of debts to Revenue Tax, That's when we take our operational funds revenues, we give it to revenue tax, and then they deposit it to DOA, and DOA pays us the corresponding amount. Right now, sir, under withholding Department of Revenue and Taxation, we only owe $198,000, and that's because we had settled up last month, early in March.
So you won't be expecting the legislature then, because in the past, this is what happened. You have accumulated over $1 million of withholding that you owe revenue and tax. And what the legislature did is, of course, took that amount, the balance, and reappropriate that money that is owed. And that's how, supposedly, you paid the withholding.
No, that won't be necessary.
This is hard cash that will be coming into revenue and tax.
Exchange. Yes, sir.
Okay.
As far as the retirement fund, we are current with retirement fund contributions.
So people can retire now.
From our end, yes. That's part of the three-prong approach of Public Law 2838. We still owe contributions for about 2 or 3 employees that have expressed a desire to retire. One of them is at the end of April, the other one I think in May, and the next one in September. But as far as our bi-weekly payroll contributions, we are current.
Okay, well, I'm glad to hear that. On the question of the pharmaceutical, the people that are self-paid, what happened if they were to be given, of course, in a prescription? Can they go downstairs and get it?
No, Mr. Speaker. What will happen if they're in the emergency room and they need to have some medicine until they're able to go to a pharmacy? We will give them whatever it is, the dose that they need to maintain that. If it's antibiotic, like let's say they come in on a Saturday night and the pharmacy, they need to take it 4 times a day. And so if they need 2 doses before to carry them over to the next day, then they will be dispensed, that additional dose. Unfortunately, our pharmacy we are still not open 24 hours, because we still don't have all the pharmacists that we need. We have a better supply of pharmacists, but we're not able to open it up 24 to open up the outpatient service.
But you're telling me that there are medicines that will be available to be dispensed by the ER at the time that, like on a Saturday and Sunday when they're, or late Saturday.
Right.
And Sunday when they're closed, that you'll be able to provide the patients with the necessary medication until Monday?
It'll be just enough so that if they have, so that they can go to an outside pharmacy to fill the rest of their prescription.
But your experience, though, as far as this is concerned on a self-paid basis, is that they're not being paid, right? For the medicine itself.
We won't refuse to provide them the medicine, sir, but as far as giving them their whole prescription from the pharmacy, no, because we don't dispense on an outpatient basis. But recognizing that if the pharmacy is closed, if they come in at 2 in the morning, the outside pharmacies don't open till 9 or 10. So whatever dose that they need between the time that they're at the emergency room to the time that an outside pharmacy will be open is what they'll get.
Okay, well, thank you, Mr. Chairman.
Okay, on GMH operations of pharmaceuticals. No further questions? Senator Shimizu.
Mr. Chair, we're not only talking about the pharmaceutical earlier. You said you can talk on both sections?
That's right.
Oh, okay. So it's not only the pharmaceutical. Peter John, nice to see you.
Nice to see you,
And, of course, Mr. Affleck, the staff that you have next to you.
I'm sorry, Senator. To my right is Ms. Jane Flores. She's the Assistant Chief Financial Officer.
Assistant Chief Financial Officer.
Yes, sir.
And where is the financial officer?
At this moment, I am the interim Chief Financial Officer.
And so that position is vacant. Earlier we had asked Mr. De La Rosa, maybe you can provide us with the copies of all the vacancies that you have inside the hospital, whether it's by the hospital revenues, all vacancies from all sorts of fund. Masaya mo ano naman matu. And the next question that I have is your in-house collections. Right now, you have about, you said you collected $46 million. For what period of time?
I'm sorry, Senator. That is just this fiscal year.
So if you divide that, you would probably be collecting about $3 million of delinquent. I'm talking about just the delinquent, about $3 million, maybe $4 million a month.
Yeah.
And that's the in-house payment or collection.
Yes, that's including MIP, Medicare.
So that's
all the
payment,
others.
or is it collecting on outstanding?
That's collecting on all the outstanding, the insurance companies, all the patient accounts.
Oh, okay. And you still have a balance of how much?
I'm sorry, $77 million that's outstanding.
$77 million, and that's what is the aging of that $77 million?
It ranges all the way from 1 day to all the way to 365
So
days.
maybe can you give me a copy of the breakdown?
Yes, sir.
You
That
know,
can
in
be
terms of
provided.
30 days. In terms of your collection, do you still, how many collection agencies outside of the in-house collection do you have?
At this very moment, Senator, we don't have a contract awarded yet. We have put out an RFP. Five responded. They have all been determined to be qualified as far as ability. Right now, there is a legal question on one or two of those vendors, proposed vendors, and so we're just waiting momentarily for legal counsel's opinion to clear that so that Peter John can award those.
Is that you're not doing exclusivity, right? You're not giving an exclusivity for one.
No, Senator, no.
Well, I'm glad that you're not. Because when I came in, it was only one, and I just couldn't see how could one collection agency collect
No, sir.
$111 million at that time. So you will be entering into additional. What was the gap between now that you're putting out an RFP versus what was? Did it terminate? Did it expire? There was no renewal provision to negotiate.
Right. What we had decided was to the contracts basically expired, and so what we did was we gathered around and looked at what would be the best business-like approach to work with collection agencies, and so we've done that. And as I said, so we just need legal guidance on a couple of points. And
what are those points?
I can't say right off the top of my head, and I don't even know if I'm allowed to say that per our.
No, you know, if you don't know, then you know.
No, sir.
So you don't know what are those legal points that are delaying more collection agents coming. But when do you anticipate? Couldn't you have cleared those that didn't have a problem?
Well, we could have, Senator, but we didn't want to. We didn't want to just award piecemeal basis. So we anticipate that we should be able to clear all questions and probably award them by Friday.
By Friday? Oh,
Excuse
good,
me.
good. Okay.
Senator, let me take that back. Maybe today's Wednesday. I keep losing.
Maybe,
the days of
yeah,
the week.
but it's going to be
Friday, no
very
later
soon.
than early next week.
Well, that's very soon. That's all of my concern is in terms of the delay of having collectors going out and trying to catch us up on a day-to-day basis. So, but that's good. And then basically that's basically my concern. Thank you, Mr. Chair.
Thank you. Senator Pangilinan?
Thank you very much, Mr. Chair. Just to follow up, I know you said your AR was about $77 million. That can't be current, though, right? I mean, current, let's say less than a year old.
Yeah, that's the total. That's all the aged AR. So that includes the current and accounts that are 365 days. That's the total gross AR.
So is there anything in your books beyond 365?
Yes. Yes.
And that is above the 77?
Yes.
Okay, so
Medicare, you were allowed 18 months. So
okay.
Yeah.
So what is your total AR then?
77 million.
But
you want it broken down by age
I guess the
category.
aging. I'm
Yeah.
just saying that it's kind of hard to see that you would be at 77, have collected 44. You are 36 months into the fiscal year.
Yes.
Your total billing is 100 million.
Yeah.
Just-
You have to keep in mind it's a rolling number. We bill
Right.
on an average about 9 to 10 million a
A month, correct?
Yeah, so that just keeps accumulating.
Right. And so, what do you do with the ARs after 365?
Those accounts are reviewed. We have an internal collection department. They do the internal collection. They call the accounts. They send out collection letters, and then eventually these accounts are either evaluated for revenue and taxation garnishment, or they're sent to the collection agency. And as Mr. Affably alluded to, we are in the process of reviewing our collection agency. So right now, these accounts, we have about $51 million that's sitting with Department of Revenue and Taxation for tax garnishment.
So 51 million at revenue tax for
Yes.
tax garnishment.
Yes.
And of that 51 million, the aging on that doesn't matter, right? As long as
Yeah.
if they don't pay, they're released. You send them 3 to 4 months maybe of billing notices. It doesn't go. You forward automatically to revenue tax to see if they have a possible tax return, and
Yes.
and they get on a suspense list over there for the issuance of their check.
Yes.
Okay.
Correct.
I was reading the financial improvement plan, and there are some numbers there that just didn't seem to balance. Peter John, and I wish I'd brought it with me, but in the one section you said that your self-pay billing or collections were up to like 4.5 to $5 million a month, but on the other section of the financial improvement plan, your total billing was 9 to 10 million, but self-pay is 35% of your gross billing, and those numbers just didn't seem to match. I'm sorry I didn't bring the report. I thought I brought it with me, but those numbers just didn't seem to match, in terms of the financial improvement plan versus your billing breakdown and so forth. The other question I have is of course, the discounts that you give to insurance companies and so forth. There's an additional kicker, you might want to say, for payment on a weekly basis versus payment on a biweekly or monthly basis. The difference between the two is?
We currently have a contract with the insurance company. They get an 8% discount.
If they pay on a weekly basis?
Yes.
Is there a discount for if they pay on a monthly basis?
No. Currently, it's just an 8% discount. You have to take into consideration when we send out let's say an example of a gross billing of $1,000. Out of that, there will be a certain percentage that's patient share, and there's also things called non-covered benefits. That's also not covered by the insurance company. It will have to be absorbed by the patient. So whatever the difference between the patient share and the non-covered benefits, that is the amount that the 8% is taken off of. So it's not an 8% across the board, whatever the gross billing is to the insurance companies.
Say that again.
Okay, if I bill $1,000, let's say there's a patient share of $20 and then non-covered benefits of $80. So that's $100 that the insurance company will not absorb. So out of that 1,000, only 900 is what they're going to pay. They take 8% out of that 900. It's not 8% out of the 1,000.
So the patient doesn't get an 8% discount?
Not for the insured patients.
That doesn't seem to. Why would you give a insurance company an 8% discount, and if I do my co-payment and why wouldn't I get that 8%?
I'm sorry, Senator. I just wanted to support Jane by saying that we do give individual patients an 8% discount when they come in and they say, I want to pay on my bill, or I want to make settle my bill. We do give them the same 8% discount.
You do?
Yes, we do. Because in her illustration, when we send that billing down to the insurance company, then they make contact with the patient, and then the patient comes up to us. So that's not what Jane was referring to, was the 8% from the insurance company. When that patient comes up to settle his or her $80, for example, or $20 in her example, then we do give him the 8% discount.
Okay.
Not at the time when we send the gross billing to the insurance company.
What is the total cost of this discount from your gross billing? What's it cost you in terms? I know you're doing it for cash flow purposes.
Yes.
but what revenue are you giving up basically?
The
What's the
last
cost?
figure, Senator, for 06, when we were discussing whether or not to give this 8% discount, renew it with the carriers, the figure that stuck in my mind, and excuse me for not having that document here, was about $1.4 million is what we had given up. And that was a figure from our risk manager's office.
So 1.4 million
Yes, sir.
is basically
For the entire fiscal year.
That's right.
Yes.
Okay. And you've calculated the time value of money and
Yes,
the
sir.
risk with regards to collections and so forth.
Correct. And also the cloud that the the carriers have over us, in that if we had removed it, they would say then they would have to go back to the 30 to 45 days, invoking the Prompt Payment Act.
Mm-hmm.
And so, as you're right, in offering this discount is for cash flow purposes.
Right. Okay. Now, you mentioned that, if I heard you right, that you can live with these cuts.
Yes, sir. Basically, what we're telling you is we can live with this cuts. It just means that we will have to be more efficient and accentuate on our other areas of improving our collections. And at the moment, we are very cautiously optimistic, and I like to use that phrase, of our collections for this fiscal year would run about $4 million over and above what are projected in our budget preparation for 07.
Mm-hmm.
That's how FMIP has assisted us internally, and we are anticipating to run about $4 million over and above our anticipated budgetary collection figure of $61 million that we anticipated for 07.
So you anticipate collecting about $60 million from the
About 64 to
about
65
$64 million of the $100
Yes, sir.
million of your gross billing.
Yes.
Okay. Now, you say you can live with this cut. I want to. How are you living with the release of the allotment under the operations fund, where, according to the AS 400 at the Department of Administration as of March 13, the appropriation to GMH for the operations fund was $3.6 million, and as of March 13, this is the latest report that I have, the release has only been $404,000.
Yes, sir. How are we living? Very tightly. We are looking at containing costs. We are looking at not allowing too many budget modifications for other things. And frankly, sir, we're just living very tightly. And so that's how we're living with the lack of release of the cash from DOA. What has been a blessing to the hospital in the past was that the Medicare cost report that had been prepared for 03 and 04 had garnished us and netted us. When we reworked it and resubmitted it, we had received some incomes from that source, from Medicare,
Mm-hmm.
and that has helped us to bridge that gap of the slow releases from DOA from the general fund.
Okay. What have you not paid because you haven't gotten this?
At this very moment, I would say the retirement contributions of 2 or 3 employees that have expressed an interest to retire. Retirement fund, it depends on the amount. Like we owe a pharmacist on her account about $156,000 as of March 10th. Every week that goes by without paying that, we incur about $1,000 of interest and penalties from retirement fund, and so that is what we need to pay immediately.
Well, that's $100,000. There's still another $1.7 million left that you haven't got. What else haven't you paid?
Basically, that's it for right now, sir. Right now is Wednesday. We're anticipating that we should receive the pharmaceutical funds from GRT by Friday, hopefully, and then that will help us maintain our payments to our pharmaceutical vendors. As Mr. Camacho pointed out earlier, Perry Point in Maryland is a great vendor in that they give us GSA, federal GSA pricing. And so we try to maintain that pharmaceutical fund payments so that our vendors that give us the best possible prices will not put us on credit hold.
House calls for doctors have been reduced greatly with the in-house physician staffing, the hospitalists?
Yes, sir. But right now, house call for doctors, we owe them about I wanted to say about 400,000, but slightly less than $400,000.
So that's another cost, I guess, that is being deferred.
Right.
And what about the any contract with any other vendors that are being deferred?
At this moment, no, sir. We have wall hardening contracts with a specific contractor. No, those are FEMA funded, and we have drawn down the 90%, and have been able to come up with our 10% cost share. And so we are current with them. As a matter of fact, last Sunday when they came to prepare the hospital, for safekeeping during the proposed storm. And so we are current with them.
And your note to the retirement fund is current?
Our note to the retirement fund is current in terms of the interest payments by DOA, I understand. But our biweekly contributions to the retirement fund on behalf of our employees are current right now. They are up to date.
But the note that you had, that outstanding note, what's the balance on that note?
Last month, because we're trying to wrap up our fiscal 06 audit, I sent a request to retirement fund, and the corpus of that roughly $16 million
17 million.
has been reduced by about $1.5 million.
So you're paying minimal principal payment. It's all interest payments?
As employees retire or resign and want their payments to be remitted, their contributions. Okay. Yes, sir.
Now, we hear that there's more than one pharmacist. There's more than one individual in the pharmacist position that you mentioned that can't retire because of the fact that retirement fund contributions are not current or have not been remitted. Is there only one person that wants to retire at GMH and cannot because of the fact that the retirement fund contribution has not been brought current? Is there only one person?
Her retirement fund contributions currently are current. It's just the past due amount, which is part of that $16 million loan.
Right.
That's what we need to get paid up.
Right. And I'm saying there's only one person in that situation.
At this moment right now, there's one person in pharmacy, and there's another person that has expressed an interest to retire at the end of April. So we need to make that payment on his behalf.
So there's nobody else at GMH that has wanted to retire
that could not. There are two more that have
so now we're up to 4.
But they want to retire at the end of September 30th. Yes.
So there's only 4 people?
At this moment, to my knowledge, yes, sir.
That's based on because they have to go up to retirement and submit their intent to retire. They have to give a drop dead date, basically.
Right.
And then what happens, sir, is that the hospital will get an invoice from retirement on what amounts need to be paid, so that we bring that individual's account to current, and then they're allowed to retire.
Okay.
But there are other people who have expressed an interest in retiring.
Right.
But the thing that that matters is when we get that invoice, because they have to go up to retirement, and then we get the notice of eligibility from retirement. Our HR will process it, and we need to make the payment on that particular employee's behalf.
Well, perhaps Peter John, we may just let a general notice then go out to the hospital employees, because I still hear people and I meet people that tell me that they want to retire but they can't because it's not current. Now, they may not have filed an application, and maybe the reason why they haven't filed an application or gone to retirement for processing is because the general consensus out there, the general knowledge out there is you can't retire at GMH because they're not current. But if people were told that all you have to do is go up to retirement, process your paperwork. They'll tell them, you'll make the payments, and then they can retire. I think you might get a little bit more interest, because I still meet people who tell me they work at the hospital, they want to retire, but what's the hold up? And they're saying,
Senator, and that general information is already known to the employees.
Okay.
If there are some individuals that may have missed that, if you can, either let me know who they are or encourage them to call, we'll be happy to talk with them. That's not a problem.
all right, we'll do that. Now the when do you think GMH can, and what does it need to do in order to become self-sustaining with regards to, we're making all this appropriation from the general fund, and quite frankly, it's the priority of this legislative body, but we also have other legislative or other services, such as public health, public safety, and public welfare, that may go for a little bit of wanting because of the need to subsidize GMH. We're not saying it's not appropriate, but if GMH was sustaining, self-sustaining as it can be, with improvements, when do you think we don't even have to worry about giving you your unreleased allotments of $2 million, and we can put that towards other operations in the government?
I'm sorry. So, I think both Mr. Afflew and I want to answer, and I'll take a first shot at it. During the roundtables that Speaker Forbes had last year, and the health area was discussed, he made a very, very interesting statement, but I thought it was very timely. And he said, "Gone are the days that the expectation the hospital is going to be self-sustaining. When you have 24, 25%, whatever it is, of your patient population who are self-pay, and of that self-pay, 6% are able to pay. There's an unfunded mandate there. We're required to pay. Unless we as a community are going to say, okay, GMH, we're not going to have to, you don't have to take care of everybody. You only need to take care of those who are going to be able to pay. Then, that's a different issue for discussion, but I'm not quite sure how we can say that we're going to be self-sustaining. We're doing everything we can to be less reliant on the general fund, but if we build $100 million and if 25% of that is self-pay, that's $25 million that we may not ever get. But the services have been provided, staff have done the work. So I'm not quite sure how to say that we're going to be self-sustaining and not have to rely on the general fund.
Well, I'll tell you how. I mean, the issue for me is when we do that, there's no incentive to fix the systems, that may cause that. What what your self-pay is. What you do is you have a program to take care of self-pay, and you fund that program and ensure then that program remits the payment to GMH. You know what I mean?
And we're doing that, Senator, but not all of those individuals are going to be able to qualify for the Medicaid or MIP program.
Mm-hmm.
Some, because those programs have guidelines and restrictions on, and it's really difficult for me to be the one to see that I would be the person to tell you or any client who comes in, sir, I'm sorry, you missed qualifying for this program by 10 cents.
Well, you may need to create just a separate program for that.
That's the MIP program.
No, you may need to create a program other than MIP for those individuals, and then figure out a way to make sure that we capture those individuals. In other words, the hospitals may be using resources now to try and chase that down where it shouldn't be, and you should concentrate on your resources and human capital to fix the systems in the hospital and provide the care. And we shouldn't, have you chase that down, and we shouldn't perpetuate that by just giving you the money to do that, and then there's no way to try and fix that system there. In terms of trying to capture that and figure out a way to harness to figure out to get some of the resources from those individuals without having you to chase it down.
No, and Senator, we're definitely, at least the group that's there now is not looking to have a blank check
Right.
given to us. We're trying to be very responsible, and we're trying to really be very diligent in improving our processes, become more efficient and more, less wasteful, if that's the criticism of government. But we're also looking at trying to make sure that we develop this database so that we can actually capture, so we can come down to the or provide information to administration and to the legislative body to say, this is really what the self-pay is. I mean, these are the folks that just can't do it.
Right.
And we want to do that, and we are working to get to that stage where we can do that to, for you folks. But we're making incremental progress, and we're not quite there yet where we can say. But that's one of the things that I've told our fiscal people is that we need to be able to say in the self-pay, because you may have a deductible that you need to pay, so you are on self-pay
Right,
until
exactly.
you meet that deductible. So we're trying to make sure that our system is tighter so that we can come down and say, of that self-pay, here's what, here's the deductible folks, here are these folks, and, so that we can come down and say, these truly are this group here, or this amount, and that's going to be a rolling amount because that's not the same, people will come in and out
Right.
of that. So we're trying to get to that point because we don't want to continue to be accused of, we're just, the charity case for the government of Guam.
Right, and what I'm trying to say is those individuals then, if we had another way to capture those guys in another system, we can have them do other things that benefit the community so that you don't have to, but you still get the money for the service you provide. That's what I'm saying in terms of how to kind of take you out of that business.
Yeah. And also, Senator, I think one of the things, and I'll advocate for, prevention. We've all heard that adage of the ounce of prevention is worth the pound of cure. And so if we as a community start looking at really investing in prevention efforts overall, in the long run, you will see those savings eventually.
Yeah. The other question I have, we hear the pressures being put by upon GMH for recently in terms of not enough beds, ER room cannot be staffed because not enough nurses, or you have to go to 12-hour shifts and so forth. Would the release of that 3.6 million, whatever you're owed, that has been unreleased of 1.8, 1.9, would that help that situation?
Well, Peter John is thinking of the right answer to that. I would say financial. Just looking at it from a financial viewpoint, it might alleviate the sense of pressure on the part of doctors and nurses. But that's all that they can do, Senator, because right now the monies that come to us will go to its intended purpose. And so I don't have the answer in terms of the psychic of the employees there. All I know is that our problem at the hospital is nothing but cash, which is the lifeblood of the hospital. So I really can't answer that question. But,
so if you got more cash, it's your lifeline, but it won't help that situation?
Well, I think it would assist that situation, but I don't know how, in what shape, manner, or form, and that's why I said I'll take it. But
pay for 2 more nurses or 4 more nurses? Or?
Well, and I think you've hit that, the nail on the head, sir. It's the availability of the health professionals to be able to staff it.
Yeah. So you have a point of information. Senator
Thank you very
Thomas.
much, Mr. Chairman.
Thank you, Senator Ping. Speaker Forbes.
Real quick, I'm just going to ask the same question I'm asking everybody. Did you guys submit a list of vacancies?
We haven't submitted it, sir, but we will
Could you?
provide it to you. Yes, sir.
Like, very quickly? And make sure that I'm glad Public Health did, make sure that you capture all the benefits and everything else so that we're looking at the full number there. And this is every vacancy that you guys are carrying on your budget. I mean, if we're talking about security guards or whatever they are, all right, every single thing. Although you are autonomous, you are subsidized by the general fund, so it'd be worth looking at that. Peter John, just a small point, your shortage of beds has to do with the fact that you have a shortage of beds. The release of cash is important to you, but you also have some longer term issues you have to address. as far as space considerations and things of that nature. And in order to be able to, should we be so fortunate as to find the wherewithal to increase bed space and open wards that are currently shut down, that ward still shut down, or did you open it, by the way?
There's one unit, sir, that because our OB ward is undergoing wall hardening, that was moved up to the one other side of the third floor. That
so you just shifted, but you haven't actually expanded
So
yet.
when that work is done, the OB ward will move back, and then we will have a space that has the capacity for 18 beds.
Will you open it?
We're looking at different ways to try to staff it, sir. Yes, actually, we're
well,
trying
that's
to
where
be
I was going.
creative.
That's
Yes.
where I was going to next. Even the ability to open it is contingent upon availability of staff.
Yes, sir.
Right now, your biggest problem with availability of staff is availability of staff, is it not?
Yes, sir.
You know, even when you have the cash to hire nurses, you're having a difficult time hiring nurses. Yes.
Yes, sir.
And even when you have the cash to hire doctors in certain special areas, you're having a difficult time just finding doctors to hire, right?
Yes, sir.
So those are some things we have to address. But I would appreciate the list of vacancies, and I'd appreciate it as soon as humanly possible, today if possible. If you want to make it easy and convenient, you can just email it to me. I think you have my email, Peter John, so just email to me so we've got it. Okay? Thank you very much.
Senator Respicio.
Thank you very much, Mr. Chairman. I just have a quick question. On the collection side, is public health current with all the MIP payments to GMH? Are you still having difficulties with the process of billing public health and public health remitting the money to?
We're getting payments from the Medicaid and the MIP program, sir.
Are they current?
Pretty current.
Okay, thank you, Mr. Chairman.
Senator Guthrie's.
Thank you, Mr. Chairman, colleagues, and welcome. And thank you for providing us all this information, Guam Memorial Hospital Authority folks. My question is, I know you often receive patients that are coming directly from the neighboring islands. Is that correct? For emergencies?
Sometimes.
All right. Now, when you receive those patients, do their governments underwrite the costs of their care?
Yes, they're supposed to come with some type of authorization from the government saying that they will pay on behalf of the patient. Yes.
And do they pay?
Well, we work with the governments, we send them the billings, and eventually they do pay, but they're not one of our more timely payers.
Okay. Have you taken the initiative to actually go to each of the island groups to meet with their leaders in order to facilitate some kind of payment agreements so that you're not waiting for reimbursements?
We, the hospital employees, Senator, don't go specifically, but we do ask the governor when he meets with these heads of states to intercede on our behalf, and we give him the information. Yes.
Okay. My thinking is this, and it's similar to the University of Guam. Oftentimes, university officials have to visit the islands to arrange for reimbursements for tuition and so forth and so on for their students. And I'm thinking that it may be worth the cost for you, Mr. Camacho, perhaps with Mr. Afligui, to actually go to each island state and each nation within the state to go over your billings yet to be paid for, and to develop some kind of agreement with the island governments, because this could actually create new customers, hopefully paying customers for the hospital. In dealing with the neighboring islands, it really takes one-on-one communications and sitting down and talking through and coming up with these agreements. I think this would be something that may help you. Also, in looking to the future, with, of course, the anticipated increase in our military population will come I think, thousands of workers to Guam who will be working for contractors on the bases, building new infrastructure for the military. And I think it would behoove the hospital as early as now to develop your plans and your requirements that you expect contractors to live up to when their employees, particularly their H2 workers, come to the hospital for help, because they will come to the hospitals. And in the Northern Marianas, they have some kind of policy in place that holds the contractors, the companies, responsible for the care for their employees, and they reimburse or pay the Commonwealth Health facility in a very timely manner for the services that are rendered. Have you thought of doing that, or have you begun this process of preparing for this?
We have, Senator.
We have.
Can you tell us?
Actually, one of the providers that has been identified for the incoming personnel is Aetna, and we're working with them already in terms of making a contract with them. So we're in the negotiation state.
Good, because I think we need to protect the community from these additional costs, also provide the services that will be needed to new residents, even if they're temporary residents, but making sure that we don't get caught in the financial bind. We have to hold the businesses on Guam accountable for the cost of the medical services of their workers who are brought here from other countries.
Yes,
That's really what I'd like to
And just
emphasize.
one more point to your point, Senator, is that we're also re-examining the mandate of the legislature upon the hospital, that maybe perhaps a slight amendment to that mandate to cover your exact point. And those are points of discussions that we have gone into in fiscal affairs at the hospital, along with Aetna, and I think one more insurance company, Blue Cross Blue Shield, has made contact with us to inform us that they are going to be covering, paying for services for some of these contractors coming in.
Wow, that's interesting news.
Yes.
I wish they would participate in the coverage of our residents on the island, and even government employees and retirees. Give us another option. We should look into that. Thank you, Mr. Chairman.
Thank you.
Senator Lujan.
Thank you, Mr. Chairman. Good morning, gentlemen, ma'am. Just actually, maybe one question, or I might turn it to a couple. What are your total accounts payable to date? And maybe the aging, 30, 60, 90 days out? How many days out are we?
Senator, it's as of March 30th, it's about 7.7 million.
March 30th, 7.7.
7.7.
7.7? Okay, and the aging of that, how many days out are we?
From current 0 to 30 to over 90 days.
0 to 30 and over 90?
Yes, sir.
How many days are we over 90? Are we into 120 days?
About 3.6 million.
3.6. Okay. In your accounts payable, is that inclusive of maybe Guam Waterworks and GPA as well?
Yes, sir.
Okay. What is that separate from the what is GWA's accounts payable?
GPA.
GPA is.
What GPA is about 155,000.
155,000.
And that's 31 to 60 days.
31 to 60 days.
Guam Waterworks is. I'm sorry. Yeah, 61 total, and
61,000.
61,000.
Okay.
0 to 30 and 31 to 60 days.
31
behind.
to 60. Okay.
And GTA is 26,000.
6. And what's the aging on that?
31 to 60.
31 to 60. Okay. You have a copy of that, right?
Yes, sir.
Yeah. Can you provide that to Bonnie? Okay. That's it, Mr. Chair.
Yes, sir.
Thank you.
All right. If there are no other questions, okay, we've concluded with Guam Memorial Hospital. It's now 20 minutes before 12 o'clock. We'll go ahead and come back at 1:30 in the afternoon to resume the committee of the whole. We'll be in recess till then.
fundings are that you've received are primarily, I know, from different types of programs, and I want to know because a lot of it comes from these other programs like HASA, Guam, and all those guys. How is this going to really affect, these programs with these reductions? Although it may be small when you think like $250 out of $10,000. What are some of the things then that you're now not going to do because of these cuts?
Senator, the larger special funds, which is on the air pollution and another special fund, those were not cut at all. So the three smaller special funds that were cut, it's very minor, and it is to promote the two of them, like the Hasu Guam, the 30,000 actually, it's 20, and then another 10 that were cut a little. It was an outreach program. It's an outreach program using the media. So what we're going to do with this little cut is just be more creative, do our ads with PSA spots that don't cost much money, and do more press releases that you could be in the PT.1 announcing our programs or our tips rather than being paid for ads and everything. So we will just be creative and meeting these cuts.
Okay, and then now this other one is the hiring of 2 environmental inspectors. I understand that. I know you're losing a lot of your employees, and we're concerned about that as well, that should you not have, the employees, then how is that going to affect you? And whether, for these 2 in particular, they haven't been hired then since October 1? Is this 1 or 2? Because the amount, well, yes, split in half is actually
Yes,
2.
it's entry level. It's environmental inspectors. No, they have not been hired yet. We do have, the GG1s are sitting, we just submitted into BBMR. And those would actually be the only 2 positions that would be funded under a special fund or general fund. But it's not, majority of the rest of the employees are funded by federal funds. Mm-hmm. These 2 positions, at the meantime that it's being recruited, this falls under the solid waste. So other divisions like hazardous and pesticide section are tapping in to at least do the work that these positions would have been doing.
You wouldn't be able to, because when you look at the dollar amount here now, it's not as noticeable, but could there be that small percentage to go from federal funds?
That's other things we are looking at.
And it'll be possible then,
yes,
without
we are looking at
jeopardizing
that.
at all any programs.
No.
Okay, very good. Thank you, Mr. Chairman.
Thank you,
Are
Senator.
there no further comments? Okay, thank you very much, EPA. We have the representative of the Guam Police Department
Thank you,
here. Are there
Senator.
any questions in the subsequent section dealing with the Guam Police Department? Senator Calvo? Senator Wonpat?
Thank you, Mr. Chairman. Mr. Chairman, we always say, of course, that the 3 areas that are very important are health, education, and public safety. And there's always been the concern that they don't have enough officers, and they don't have enough vehicles, and all that. And we're looking at over $558,000 that's being reduced. And I'd like to know specifically what are the areas in which the cuts will be made, and how would you be able to deal with the less amount that the agency is going to be
Okay. Chief
having to live
Suma,
with.
would you go ahead and respond to the gentle lady?
I would like to, if that's okay with the senator, to repeat that question. I'm very sorry. Yeah, but if I can just hear the detailed question.
The $558,000, $558,675,000, is what is being reduced from your department. So my question is that it's for operations and other things. So how then are you going to make up for that, and how are you going to live with that? What's the impact, and how are you going to deal with it to fill that void, or that amount that's not going to be there? Because it says here relative to also implementing, remember, the use of personal vehicles for official purposes. So can you please just briefly address that?
Okay. First of all, I'd like to thank this body for inviting us. And I thought, and I mentioned this to Senator Pangilinan, this is truly something that we appreciate, because now we're getting to really get together and identify how we're going to resolve this together as a team. And speaking of teams, I want to also just mention that I brought with me our ASO and also an acting division chief for administrative division, Ms. Kathy Tyrone. And she has the detailed answers together with us today to provide some of those answers to your questions. I also brought with me our only major in the police department, recently promoted to major. I thank God he was. We have 6 divisions. In the past, they were headed by majors, particularly during Colonel Scamby's time as chief. Today, we have 1 major, and you're looking at him. So what we had to do is put Major Rick directly overseeing the operational or our operations divisions, and those include our neighborhood patrol. That's the 4 precincts: Dededo, Agana, Agate, and Southern. He is also overseeing Highway Patrol Division and the Special Operations Command, which is your SWAT, Executive Security, the Harbor Patrol officers, the K-9 team, and anyone else he can answer for. On the administrative side, Ms. Kathy Tyrone is the acting division chief, but she also oversees anything to do with records and ID section. And I could give you a copy of the organizational structure. And then Captain Ryan, our only captain on island and active, because Captain Chargaloff is deployed to Afghanistan. And so he's not available to be with us for 18 months. So Captain Ryan is overseeing the support division, but he's also directly in charge of Top Off 4. But to get to your question specifically, what are we going to do in relationship to the cuts and what we face for the remainder of the fiscal year in the future? I would like to say again, it was a team effort. Long before this actually came about, the Guam Police Department staff and employees, civilian and uniform, began sending in what they personally represented for themselves and their sections under a cost-saving measures outline. And then what we did for you here today, and first it was sent to BBMR and the governor's office, was to put together a compilation of these items. And I think you have a copy of that today. Is that what you were asking about? Okay, we'll make sure that we get you a copy of this. It was a memo directly to all GPD personnel, and actually it was prepared by them, but now it's for them. And then that they would be represented by myself and the staff beside me to not only the BBMR and DOA and the governor's office and the lieutenant governor, but at the time when it would come forward, like in this forum. And if you would like, before I read it, if we can have someone make copies for you. And while they're doing that, I could address the question related to take-home vehicles. In the past, we had different entities within our organization that needed to take home vehicles so that they could have a quick response to a crime scene or to an emergency, whether it be man-made or natural disaster, so that they could respond directly to the situation rather than the time lost from point A, their residence after hours or on a weekend, to a traffic fatality. This was first brought up with Highway Patrol. They would have to respond to the numerous fatalities that we were having for quite some time. On Guam, we have annually 10,000 crashes. That's too many for a small island. Besides the fact that the military buildup hasn't even really begun, we're going to see a need for more highway patrol and activity. The thing that happened was that when the officers were finding out that there was delays in getting not only the investigation going, if they had to go from their residence in Pneumatic or wherever to a crash site, and they're going to get there in their private vehicle, they had no means of securing the traffic crash site except for whoever were already on scene from the precinct personnel. And because resources are limited as far as personnel and vehicles from the precincts, they could not stay at a crash scene to maintain public safety at the scene so no further crashes would occur. And we've seen that happen when there's no patrol car there with blue lights going in to remove the victims to the medic and to the hospital. So what they were saying basically is, give us the ability to become truly mobile. We need those vehicles to go from our residence to the scene and begin to conduct the scene. So what we have done collectively is looked at that and said, okay, here's what we could do. This happened during Major Agege's tenure as acting chief. We decided, let's do this. If you live in Umatic, like, for example, Officer Pat Sanchez, who's been a long-time traffic enforcement officer and investigator, highly trained, highly skilled. Rather than taking the patrol car all the way to your residence, you take the patrol car to Agate Precinct. You can drive your POV to Agate Precinct, jump in that, and then take it to the crash scene, whether it be in Jigo or just in Umatic, wherever, at least you're there. And the others that needed to pull the light trailers, because if it happens at night, they need to pull the light trailer, then you can take that vehicle and pull the light trailer. The question was, where do we place the light trailers? Those light trailers are very expensive. They are generator operated, standalone generator. So people have an interest in stealing that generator because they can take it to their ranch or whatever. So to protect that, we could not place those generators out in the field. They could disappear even from, sadly, a police precinct parking lot. So to resolve the issue, we started letting people take vehicles home. That included criminal investigators because we saw that there was a need for investigating, like the recent kidnap and murder of a Korean resident, female resident. And so to get officers there quickly, in that case, the people were at work. But if they were off duty, or if it was a weekend and they're off duty and at their residence, they needed to go and get their vehicle. The next question came up, well, what if they're off duty and the car is at their residence, but they're at some party? Well, that's why we developed the on-call roster. And the on-call roster stated that if you're on call, you're not going to be free to roam around and to be away from your equipment or your vehicle. You've got to be right there with that vehicle. So that posed the question now, with the financial crisis, does everyone need to be on call that was on the on-call roster? And that's where, between Kathy, myself, the colonel who's not here, and Major Rick, and the other lieutenants and sergeants, we had to come up with a plan to identify who are the on-call personnel from each of those sections that need to be responding. For example, in CID, besides homicides, they investigate criminal sexual conducts. Those cases seem to be on the rise. We're seeing young minors being violated in that manner, that terrible manner. And so they have an on-call roster for the female investigators to go to either the hospital or a clinic or to where the investigation is taking place, to be there personally to ensure that crucial evidence and information is obtained. So that's where this on-call roster came about, and there's still going to be a need to take these vehicles home. But it's not going to be in the past where you even saw administrative staff like myself, the chief of police, the colonel, the major, and so on. We'll have a full list of who has been taking cars home, and there's good reason for that, but now we're going to narrow it down specifically to the on-call. And we're going to monitor it week by week to determine how much fuel we've actually saved, so that can give us a better comparison as to what we want to do in the future. Because the other study we're trying to do is not only take home vehicles and cutting that down to bare necessity, but we're also looking at the types of vehicles that we've purchased in the past. We have a bunch of SUVs, Tahoes and Expeditions and the like, that I believe are consuming too much fuel, adding to the pollution in the air that may have been, like our former Vice President Al Gore said, is working quickly to destroy our ozone and the poles. Whether that's true or not, the reality is we're burning fuel, and sometimes needlessly. So there are many things we've attached to this, but not only no more take-home vehicles except for those absolutely needing to respond to critical cases and more importantly to save a life, like the Harbor Patrol. They need to have their mobility so they respond and get to the boat quickly. so they can get out into the waters to rescue someone. But also, we are looking at how we are going to save money on the purchases of vehicles that we're looking at hybrid vehicles for administrative purposes. We're looking at when the precincts send an officer from Agate to Tizan to turn in reports, pick up reports, to make sure that administrative documents are addressed, that they are not going to use the vehicle clear from Agate all the way to Agana. But what they're going to do now is the precinct from Agate will send their administrative sergeant or personnel, pick up or drop that car and take the one from Agana. Why aren't we just emailing all those things? Because certain documents have to be signed and accounted for in person by the officer, the CMO, case management officer, who is the admin officer, to bring that directly to records or wherever it needs to go. And so you can't just email some documents. I could go on, but I think some of you have some other questions. So,
Senator Wampat, is that all your questions?
That when he wanted to have these copies made for us, then to now talk about the cuts and.
I'm sorry. Can you get a little closer to the microphone?
I'm sorry. He started to explain the personal vehicles for official purposes, because that's the part that's covered in the bill. But he also said that he was having these copies made for us to then present on how they're going to address those cuts. Then, so maybe just briefly.
Yeah, I think the copies have already been presented to the members of the body.
Okay.
Senator, would you like to request that he go over the?
Certainly. Yes, because then we're looking at 558,000.
Okay.
And I was trying to read this, but you're going to have to tell us exactly how you're going to make up for that.
Yes.
Just a point of information real quick. The gentleman provided something. In the direct question was, how will you be able to live with the cuts? And so maybe you can articulate how this amounts to living within the budget that is before you.
Okay. Well, and then again, just to reiterate for some of the senators that just came in, the people of the Guam Police Department decided, you know what, we need to do our fair share too. Although we heard public safety is not immune from the budget cuts and everything, but we need to do something so that we can serve the public better. They agreed to come up with this strategy, and then we compiled it to read in this fashion. I address this to all GPD personnel, subject to emergency cost-cutting measures, government financial crisis. And it states, effective immediately as an urgent course of action and to prevent further debilitating effects on our ailing governmental finances, because we are responsible for that.
Mr. Chairman.
I'm sorry.
I think everybody has a copy of the journal or the
Okay, I'll speed it up then.
So
all right.
maybe just summarize it.
Sure. Number one was the most important, and that was an immediate moratorium, a temporary moratorium, because we can't eliminate overtime completely for any length of time because we don't have enough people to service the community. So we put a moratorium out on all overtime except for those that are going to be conducted to save human life, and that means rescues on land and sea. Okay, and then the other one was to reduce the number of take-home vehicles so that we save on fuel costs and also vehicle maintenance costs. And then there were many others. Of course, the basic one, shutting off the air conditioners, the electricity, and things of that nature in the offices where they can be shut off, because some are 24/7 and you can't shut off the ACs for computer equipment at MIS or in the precincts that are running 7 days a week. The other one that I thought was really specific to where we're not serving the public professionally is when we take too many long lunch breaks and smoke breaks. Now, some people thought that wasn't a good thing, but I'm sorry, we're looking at healthier officers so that we don't have any more cuts in our availability of police personnel to be responding to complaints and incidences. For example, 5 patrol cars at a restaurant, everyone eating lunch, although they may be on a 12-hour shift and they want to share information during their lunch hour. That was absolutely, not frowned upon, but they were told by their commanders, no, you need to be in your beat so that you're closer to the problem, so that we save fuel and you're also safe so you don't respond and kill or injure someone in responding to the crime. Police services such as police and funeral escorts, we were looking at not only how we're going to save money, but how we're also going to provide continue to provide services to the community as we've done traditionally, but we've never charged for the service. But we've heard, and I have to meet with these people personally, is that some funeral homes have been charging their customers for the police escort, and we have not been financially helped out with that. So we're going to look at charging funeral homes for funeral escorts to include other sporting events. We already do it for the PXCs and events at UOG. And how we're going to do that, we're going to charge a reasonable fee, an average fee, possibly around the area of $25 per officer per hour. And then also for the vehicle, we're going to look at what the car rental companies use, but it's going to have to be a notch higher than that because we're talking about police specials. That includes the lights and everything. So there's a cost for maintenance and fuel for that. And that's motorcycles or police cruisers. And then, and Kathy can answer this more specifically because she oversees the operations at the Records and ID section. When was the last time we had raised any fees at Records and ID section? It's been a long time. And what we're doing right now has not been able to cover the cost for some of the materials that we utilize there. So we're looking at raising the fees for example, police clearances, report abstracts on criminal and traffic complaints or issues or accidents, Guam Firearms ID, Guam Firearms Identification Cards, Guam ID cards, Guam firearms registrations, and there's quite a few others. So it's going to affect all of us, even in government, because there are many government agencies requesting for these things, but we're going to have to set a price for that too and charge them. We're being charged for our power, so we're going to have to charge other agencies for the use of or the materials that we provide in that service. We're doing our best, and we've done quite a good job of consolidating our personnel and the functions, eliminating excess phone lines and extensions, and also T1 lines. And the consolidation has helped a lot of people because they don't run around all over TGen or all over the island trying to find police services. So we'll also make that available to them in the form of a consolidation. It also cuts down on the number of facilities that we have to pay the airport for rent, which is something that former Chief Ishizaki and Senator Ishizaki and I and the folks at GPD are still working on as we speak. And of course, we will abide by the hiring, promotion, the travel freezes, and eliminate the holiday work pay, because sometimes some folks were coming into work, holiday work, and we found that could have been done during their regular hours. We cannot eliminate totally holiday work or night differential because there are night shift personnel in order for us to cover the mandates of a 24/7 coverage for police presence and response. And then lastly, we will maximize all federal grants, federal funding sources, and search out all other cost-cutting, income-generating measures as they present themselves. And so we've reached out to not only you folks in the legislature, and I guess that's why we're here, but anyone else that can contribute to any ideas that we haven't addressed. And we're going to make it a challenge and a competition. Whoever within our ranks can come up with better solutions to these things, by all means join in. Now, Kathy will be more specific. These are things I outlined just from the airwaves and from the people that put their thoughts together, but she can answer more specifically regarding that figure that was stated, $558,000, I believe, and some odd dollars. Ms. Kathy can address how or where that savings will come from when we've done our part to make sure that and ensure that this is followed. So if you'd like, if Ms. Kathy can answer.
Senator Wampat, I think that covers the questions by Senator Wampat. Senator Tenorio.
Thank you very much, Mr. Chair. Maybe we should go ahead and defer to the gentle lady from Sanahania who could talk about her crunching of the numbers. As the ASO, I'm sure, Kathy, you know that the issues of the fire, police department, all the agencies in law enforcement and public safety are dire to everyone in the community. But, you know, albeit we need to live within the financial constraints. What is the cost-cutting measures that the chief was referring to ultimately result in savings over the course of the remainder of this fiscal year? Can you live within the budget cuts? The answer was yes. How much do you actually save by virtue of the measures that you're implementing?
budget cut. We would be able to live with that 2.5 cut with the reutilization of human resources, which is we're going to be cutting, which would show a more cut in overtime. Because when we were tracking overtime, we were burning a higher amount than usual, but we're going to be able to cut that back. But that means reutilization of our staffing, just so that either the officers are being transferred out in the field and leaving the task force or special areas just to accommodate patrol at this time. Also, during this part, we're going to be cutting back on contractual, cutting back on supplies, and that should total our $558,000.
Okay.
Primarily, it's all going to be within overtime and contractual fees. But there's also one provision that's in this bill, which is under miscellaneous, which they're trying to take out on section 26, chapter 5. That's our cadets that they allowed us to hire 63 cadets. We have so far hired 20. We have 43 that are in the process of background checks, polygraphs, and we're getting ready. And we've already selected some, but this money also pays for their training, and it pays a contractual fee for a GCC. So if that was taken away, I don't know how we would be able to continue the cadet program. That's taken out of the cadet program. We could do the 2.5 at $558,000. I'm just asking to not cut the cadet program.
Okay. Let me just ask the major real quick. With the existing personnel, albeit we also understand there are a lot of deployments, as the chief is referring to, with the cuts and the personnel that you have, will you be able to meet the mandate, the mission of the department to protect and serve the community insofar as public safety?
Yes, there, Senator. Like the chief said, a lot of the officers that are placed on administrative and support portions of the department have been put out to augment patrol. And as we speak, 2 precincts out of 4 are now implementing the 3.5 days on, 3.5 days off work schedule that will provide adequate manpower out in the field. Yes, there are deployments, and we're just waiting that there are officers that are scheduled to go off island for basic training, and once that happens, then that precinct will then revert to a 12-hour work shift.
Okay. Referencing Ms. Tyron's comments regarding the additional 43 recruits or cadets that are going to be hired on board with the appropriations called for in the budget, which is a continuing appropriation from prior fiscal years, which you haven't been able to this point, fulfill. Will you be able to continue to, again, at the existing personnel level, maintain the level of security that you currently have without those additional 43 hires?
We have to consider the fact that officers are working 12-hour shifts now. We do have a plan in the event that it wears out the officer, and that is to just move people around. But the additional 43 cadet will surely assist patrol at the same time, take care of the health of the officer, because 12 hours is a long time, and we really need those positions right now.
So are you basically adding more overtime to the operations by virtue of the 12-hour shift since you don't have the adequacy of personnel?
No, we're not, Senator. That's 3.5 hours on and 3.5 days off, I'm sorry.
Right.
We are within our 43 hours per week. But, the sustainment of that work schedule, we can probably, the officers can hold that for maybe another 6 months. But the plan B for that is once I notice a stressed level increase in my officers, I need to move some officers out of that precinct who are currently on 8-hour shift down to this precinct so that they can go back to 8-hour shift to ease of the stress. So yes, we're manipulating the manpower distribution of personnel. And to top that off, with me overseeing a lot of police operations, if there is a need for patrol in a particular event, let's say the liberation or whatever. I have the authority to move people out of CIS or SWAT to augment them so that there's no overtime accrued.
Which is the same thing that we've been doing for years. I did 12-hour shifts at Timoni Precinct for years, and I went from specialized investigations, CID homicide, to the parade every single year. And this is the same thing that you're talking about, correct? To try to minimize the number of hours of overtime, you go ahead and have somebody perform the parade in lieu of doing his 8 hours at CID or wherever he may be assigned to in a non-field assignment.
Yes, it's practically the same thing. It's just that back then, you have division chiefs that are very territorial. They want to relinquish their personnel, and that's when like it or not, you have to work overtime. Well, me, then I can direct these people. Hey, get over there and work because you're not investigating no homicide now.
Right. Okay. So your answer to the question of whether or not, of course, these additional personnel are needed is an unequivocal yes, they are needed. The point is that at this time, the administration is looking to not proceed in filling those vacancies as the administration again has decided, we're going to put a moratorium or suspension on a number of different things because we need to live within our budgets. Is that right, Mr. De La Rosa? I mean, for example, the fire department promotions has been put on hold temporarily. These are necessary things. Is that what the administration is effectively asking?
That's correct.
All right. So just like the promotions of the fire department, just like the hiring of the additional 43 cadets, are these things that the administration would like to see implemented at some time in the not too distant future and hold on for now?
Absolutely. If I could just clarify, the repeal of these specific provisions were based on our concern that there's not a direct appropriation tied from this year to them. And so it's not to say that in the order of priorities that additional police officers is not a priority. For us, it's just a matter of, as we make the effort to balance this budget, that we ensure that there are revenues tied to the appropriations.
So then, again, let me ask the question then, is currently, and you basically the administration through our conversations in the many weeks leading up to the budget had requested for, and a number of agencies have requested for, the authority to use appropriations which should yet to have been fulfilled in the past as a measure to be able to fulfill these needs, whether it be the police department to continue the appropriation from prior fiscal years, or the fire department to allow for the promotions, and a number of different things to meet the needs of all of these agencies. So this is something that it was a byproduct of conversations that were had.
And we recognize that's kind of the normal course of this process, that sometimes funds that were not used last year to hire cadets would roll over and continue. But as we deal with the cash flow issues as well, it makes it more difficult for us to find that balance between what the obligations are and what the revenues coming in.
Sure.
And so it's not a criticism of the use of carryovers or unencumbered funds. It's a matter of the circumstances we face today.
So
let
me
try and find that balance. In addition to that, the way that BBMR treats the requests that come in for the recruits and things like that is based on need. So the discussions are had with the departments to see do these additional hires reduce the cost of personnel in terms of the trade-off in overtime, and they take into account the recommendations based on the health of the officers as well. So again, it's the repeal of those provisions were not specific to a recognition that they don't need the cadets. We believe they do. It was an issue of trying to balance this budget and trying to tie appropriations directly to revenues directly to any obligation that we make.
Sure.
Just specific to the crisis we face today.
So, specific to the police department, for example, the monies that were earmarked for the cadets to be hired and their training and equipment, were there monies put in those accounts for that specific purpose? Are there monies in those accounts?
I can't answer that specifically. I know that at this point with the cash that's coming in, it's really just, it's day to day. The money comes in, it pays for an obligation. So I can't imagine that there's money reserved for that right now.
Okay. Ms. Harmon, are you aware of any monies that are immediately available for the fulfillment of that cadet recruitment? Are there actually monies in the account?
The money is in the account. Actually, there's cadets being paid out of that account already. And there's already the contract to the Attorney General's office, which I certified funds available prior to this coming out.
Okay, Mr. De La Rosa.
Like I said, I can't speak to it directly. I don't have the information with me.
Well, my concern is that if we say we're going to go ahead and proceed with the elimination of that account and the monies that are allocated there, and there are individuals currently who are on hire who rely on those funds, what happens to those individuals?
No, I'll provide that information for you, and if there needs to be amendments to the language to ensure that those don't get jeopardized, we'll provide that as well.
Okay. Because it's important for us to make sure that obligations that have been made against those figures where individuals who are currently tied to a obligation, whether it be cadets or contracts, etc., we do need to look out for what commitments have already been forwarded. If there has not been any progressive action toward the fulfillment of that, then that's something that, of course, I think the body is akin to look at. So again, thank you very much. I really appreciate your testimony here today. Thank you, Mr. Chairman.
Thank you very much, Senator Tenora. Senator Gutherts.
Thank you, Mr. Chairman and colleagues, and welcome to the GPD folks.
Thank you.
Just a few points, Acting Chief Suba.
Yes, ma'am.
You know, it's interesting. We've gone through these same circumstances many times at the police department, at the old DPS, financial difficulties. And I know that DPS and GPD has always done its part to try to conserve monies and be careful on expenditures in these difficult times. A couple concerns I have is, first of all, as was asked by Senator Tenorio and discussed, my understanding is that we do have individuals who have gone through the process of applying for police officer positions. They've been tested, they've been interviewed, they've been ranked by the Department of Administration, and at this moment they are waiting for a academy class to start under your direction.
Right.
Now, again, if your budget was reduced by $558,000, is this going to therefore stop you from proceeding with that recruit class and the academy for that recruit class?
Ms. Cathy would like to answer that.
Thank you.
Actually, that's the account under the miscellaneous provision that they want to take out, and that's the cadet classes, and that is our contract that we're working on, or agreement with GCC, and that is out of that funding. And we've already been working out with GCC. The 12 officers or the 12 cadets are already attending classes, and they hopefully will be graduating soon. Those that we are bringing on, we are now working out that contract out with GCC also, but all of the funding is dependent on that provision under miscellaneous.
Okay, so you would be impacted then?
Only under that provision, but on the 2.5, on the 558,000,
you would not.
It does not impact the cadets.
Okay, that's good news, because we do need those recruits.
That's right.
And I have to say, especially with my colleagues, you know, we're very fortunate, Acting Chief, because we have a number of folks in this room who were in law enforcement and who understand the issue of having adequate uniformed personnel on patrol to protect this island. And we also know that we've seen a rise in robberies, burglaries, drug actions, etc. And the best way to mitigate that is through visibility of officers in uniform. Now, my other question is with respect to your police reserve program. And some of us who went through that program and served as police reserve officers are wondering how much of a priority is that with the department, and what have you been doing or what can you do to enhance that program, because there's many folks who would be willing to volunteer as police reserve officers, which would make a great contribution, a public service contribution to the community,
Yes, ma'am.
and also help alleviate some of your shortages.
What we've done is maintain the police reserve program. However, at one point they were reporting to TGen, and so I'll let Major Rick answer that more specifically, because he has been one crying out for more reservists to be at the front line where they're needed. So we're trying to ensure, one, that they don't report to TGen and take away from where they're going to be distributed, where they're needed, like you said, for visibility. The other thing that was happening is they were complaining, and with justification, that they weren't getting treated like the regular officers to get a patrol car, to, handle cases, and like regular police officers. There should be no distinction other than the fact that they are volunteering, which puts them even at a higher level of honor, because they're doing it subsequent to their other jobs but coming in to help. So what we've done, because we have to put them through a cycle, and that costs money, is the ones that we do have, we've made sure, through Kathy's efforts, to make sure that their stipend pay, but also the Major can answer what he's done in the precincts to make sure they're taken care of, to include now vests, because they weren't afforded bulletproof vests for whatever reason, and they face the bullets and bleed the same blood as our other officers. But what we're also doing now, because of the dilemma with money shortages to get a cycle going through for the reserves, we have what we call the CAPE program. And I want to thank Senator Ishizaki when he was the chief. It was developed from VIPs that already originated around the country. But here on Guam, we turned it into the CAPE program, and that's community, what is it? Outreach, authorized and assisted. We authorize them to assist us in policing the community, and they issue citations for those parking in the physically challenged parking. But not only that, we're going to expand that to include teaching the mayors and the community leaders on crime prevention methods, using checklists for security checks of homes and businesses. In addition to that, we are going to hopefully expand it when these volunteers come in under that program, that they will have now under their belt some historical information and training to get them guided into the reserve program, where they can now get into a training to include the firearms training and the vehicle operation, and then the laws that we are seeing in the academy provided to the regular and the civilian police reserve component. That's the way we're dealing with it now. Although we can look at it as a Band-Aid approach, it truly is a good infusion of additional bodies. But don't get me wrong now either. These people don't just come in and they say, I volunteer, now they get this nice little cute badge that has the emblem or logo. They have a background check. They have security checks done on their background for the sake of where they're going to be dealing with enforcement of laws. And then they're also trained to testify in court already in that organized group. But Major, do you have any comments you'd like to address? How many perhaps reservists we do have and where they deployed?
Yeah, actually, we have about 20 active police reservists now that are farmed out to the precincts. A handful of them with specialized training and skills are assigned to SWAT. So those that want to come in, if they meet the standards, they're more than likely be picked up. But to boost the morale of the police reserves, they are they are included in all interdepartment trainings. They are given the same vehicle that the police officers use, and the same. As a matter of fact, we have police reservists out there that report to duty more frequently than regular officers. And we're glad that we have these reservists. And as we speak, I'm looking at trying to establish a standard for outward mobility for a certain grade that was agreed upon with the reservists, to show recognition that they are not green officers, that there are seasoned officers out there. However, there are still police reserves.
Very good. I want to encourage you as much as possible to to expand that program. And, you might be able to start an academy, Acting Chief, with volunteer instructors who are certified and able to instruct for the reserve program, just to get it going again and get more recruits coming in. I'd like you to think about possibly exploring that. And another suggestion is, and this is something I think would be really great, is if you can connect with the criminal justice program at GCC and UOG, and if there's some way we can help you with legislation to entice the students majoring in those degrees to become police reserve officers or another category of volunteer officers, put them through the training, and in exchange for their volunteer services, perhaps the government could find a way to waive their tuition and books for a particular semester. I've talked to students about this before. They seem to like this concept. It's just a matter of writing up the proposal, perhaps the suggested legislation, and for the senators to look at it. But the CJ majors, both at UOG and GCC, would be a great source of additional resources for you if we could entice them with a tuition waiver or a tuition reimbursement and textbook reimbursement approach. At any rate, I am a little concerned about the reductions for the police department, but you folks indicate that you think you can handle that as long as your miscellaneous monies for the academy aren't touched, so you can do those recruits. Now, how many uniformed personnel do you have right now?
Right now, for example, the precincts alone, we have anywhere from 24 to 30, and then each precinct indicated how many they have deployed. But to be more specific, perhaps Kathy can answer not only for a uniform, but civilian population.
Yeah. Kathy, how many uniformed personnel do you have right now, or at least filling FTE positions, uniformed?
Uniformed personnel are approximately at 340 now.
340. And how many uniform vacancies do you have?
I would like to see it double. Funded, I'm sorry.
Yeah, that are not filled. You're not, okay.
We don't have.
You have none.
That's not funded.
Okay. Of your, you said 380?
No,
40.
approximately 340.
Okay, 340. Of your 340, how many of them belong to the reserves and the Guard?
Major can answer that. He's with the Guard.
Right now, we have 70 uniform officers in the Armed Forces Reserve. Comes next month, 3 or 4 more is
they're swearing in,
joining in for en route for basic training. So, getting out of the reserves. The Guard provided very lucrative benefits for them to stay in. So they're still in, sir. Nobody's getting it.
There's one civilian that is going to, what do you call it in the military? It's been a while since I've been in ETS or
yes.
Transiting out, permanent transition out of the military. One civilian, but that's not going to help us.
Well, this has been a perennial challenge for the government of Guam, particularly in law enforcement. And, we have to give great honor to our officers that serve our country. But we also need to recognize that it does create a lot of gaps, and we have to be creative in trying to fill those gaps.
Yes,
so your reserve program is one, maximizing your personnel, which Major Rick seems to be doing, and looking for new opportunities. Look at those CJ students. See how you can work with the legislature, maybe to develop a bill that would waive their tuition and books, provided they give service and are trained by you for that service. In exchange for their help, and also expanding other programs that you have.
Yes, ma'am.
But just hang in there and please continue protecting our people on our island. Thank you.
Okay, the line of speakers will be as follows. Speaker Forbes, Respicio, Isisaki, Palacios, Munya Barnes. Okay, Speaker Forbes.
Well, first off, I want you to know that Senator Pangilinan and I are both interested in joining the reserve, but only if we can be like Lieutenant Columbo from the old TV show. we want to wear some kind of beat-up old coat and walk around with a cigar.
Well,
we want to say things like, you got to answer this one question for me. There's just one thing I don't understand.
One more.
We can do that. Yeah, Senator Calvo will join if he can dress like Dirty Harry. That's what he wants to do. You don't have any funded uniform vacancies, right? Zero. Because I was pretty sure that you were.
That's what she said, yes.
Yeah.
Zero.
Do you have any funded civilian vacancies?
Actually, we have the psychologist and the clerk typist 3 that had resigned.
Okay, can you do me a favor? If it's only 2, that's fine. Can you just give me a listing of the 2? It's the same question I'm asking everybody. I just want to know what you have that's vacant that's funded.
Yeah, I have the listing out. Actually, and also under local funds was included the 43
I'm
cadets.
sorry?
The 43
cadets.
43.
Yeah, under the local funds is 43 cadets,
Oh.
1 clerk typist 3, and 1 psychologist.
Now the 43 cadets.
And 6 law enforcement dispatchers.
Those are dispatchers. Okay, the 43 cadets are vacant?
Well, we're into the process of selecting, but they need to go through, and we've done the background checks. They're now doing psych evals and polygraphs.
And this is the next cycle, right?
That's correct.
And that's already funded, right?
And this, yes.
I don't think anybody's interested in messing with that. I just want to
Thank
know
God.
what kind of civilians you got. You got a psychologist. Do you have any plan?
Psychologist, and there's been no applicant.
Oh yeah.
To now. And then we have 6 law enforcement dispatchers.
And what's up
we
with
have
that?
No applicants right now.
Nobody wants to be a dispatcher?
We need to review the qualifications. Of
Okay. Well, let me ask you a question. What do you think the likelihood is that in the next 6 months you're going to fill either well, could you live without the clerk typist?
Actually, the clerk typist 3 was for records and ID. That was a section that used to have 20 employees.
So can
Now
you or
just
can you not live without the clerk typist?
We're having a hard time living without it.
Do you plan on filling that clerk typist in the next 6 months?
Yes, actually, the certification list is being prepared by DOA already.
So when do you think that'll be filled?
No,
I want to know.
background checks again, so not maybe for another 2 more months.
Okay, but definitely within 2 months?
Approximately.
I would
due
say,
to background
yeah.
check.
I just want to know that it's not going to be like September 31 and the position gets filled.
No, it would be before September.
Okay, all right. And then the 6 dispatchers, what are you going to do about that?
Actually, we're going to have to we need to review the qualifications on that.
How long does that take?
That's not going to be filled this year. We
Well,
need
then,
to go through civil
if they're not going to be
service and take
filled,
a look at that.
if they're not going to be filled, that means that money is going to lapse. So there's no point in lapsing money under the current economic conditions. We're carrying that in this budget. So since the administration is so keen on making sure that there is a one-to-one connection between what we appropriate and the availability of cash, that's an important thing to know. So could you note that you're probably never going to fill those positions in this fiscal year?
Not this fiscal year.
All right. What about the shrink?
That's been down at Department of Administration on an announcement for more than 6 months.
So the odds
There's
are
no
that.
applicant up to now.
So the odds are you're not going to get a shrink in the next 6 months. So those are 2 important things, because if you're not going to fill them anyway, there's no reason carrying them as an appropriation for the rest of the 6 months. It just makes the number bigger than it needs to be. So that's the kind of thing I'm looking for. So Kathy, if you could get me a copy of that.
Sure.
Just drop it off at the office, or because I don't have a desk down here. I'm borrowing. Right now I'm Edward J.B. Calvo, as you notice. So if you guys on the way out could just drop that off at the office, that'd be nice. Okay, guys?
Very good.
Jesus Masi. And I was just kidding about the Columbo thing.
Well, look into that.
No, actually, we want to dress like Sherlock Holmes. That's what we want to do. And we want to say, elementary, my dear Watson, and stuff like that. Thank you.
Thank you. Senator Respicio.
Thank you, Mr. Chairman. If there are no objections, I'd like to go ahead and have Chief Ikazaki speak before me, so if I can speak after him. Senator Shizaki is oversight chair is asking to go before me, so if there's no objection, I'd like to.
Okay, Senator Sasaki, you're recognized.
Thank you.
I appreciate Senator Respicio's generosity and support. Of course, I'll have to pay a price for it later, but no fear. Anyway, Chief, Kathy, Major, thank you for joining us. And, we have a lot of questions. People are asking a lot of questions, but one, you answered the numbers, and I'm looking at the numbers at the precinct, 24 to 30. That's a reduction in staffing, I think.
That's correct.
Yeah.
Definitely. And we had a population of less than 150,000 when we were a lot higher than that. And then we're talking about military buildup on the island and hope for more tourists. But when you look at it, there are not 120 officers out there covering the beats at 24/7. You are looking at one supervisor, one desk watch, who has to be there at the desk watch, and then possibly 4 personnel covering roughly 21 villages, I believe. And in each one, they're not the same population. You have Jigo and Dededo with some of the larger populations, but Tamuning and Tumon precincts being the tourist attraction and where the businesses are. So when an officer is down, say, for example, there's a fight at UOG Fieldhouse, God forbid, but a riot for some reason or another, all 4 of those officers are going to be required to be there, and then the adjoining precincts are going to have to send personnel. That means that the rest of the villages are not covered properly for the safety of the community.
Yeah, and I'm looking at your memo that you sent to the personnel on March 28, and you've placed a temporary moratorium on overtime.
It's temporary because that's what I was told, that we're looking at better days with the military buildup. But the other thing that I assured them is that not necessarily that it's temporary in nature, but that I've already communicated with Chief Charfris, for example, from Airport Police, Port Police, and our other brothers and sisters in local law enforcement and federal, that during this time of crisis financially, we're also going to need their assistance to back each other up, whether it be at DOC or whether it be up at the airport. We're going to have to help each other. And I saw that really truly come about on the tsunami watches that just recently came to the island. And they did afford us the personnel to help us. If you recall in the news also, airport police were able to apprehend the miners that went down and stole from the Home Depot, which can really hurt our economy and, of course, them individually. So we are helping each other, but that, again, is not going to resolve the issue that our officers are stressed. As the major said, some 4 individuals have died. I cannot say specifically that they're deceased because of stress factor, but I do believe that contributed to them. And so that's why we're really trying to be diligent in reducing the stress level to our personnel, civilian and uniform, but also getting them involved with health programs. But how can they do their health program when they have to be called to all of these criminal cases?
So it sounds to me like what resources you had like a few months ago compared to today, you've had a reduction in actual officer on duty at any given time.
Yes.
So that leads me to the question, have we checked on our response time? How long is it taking to respond to the 3 levels of responses?
I'm glad you asked that question. The response time has been reduced, has been reduced dramatically. But I'll tell you this, for the benefit of the officers, they're doing a great job. They just can't make it to every call as quickly as we used to, and that's a detriment to the victim if you're that victim. But what has happened is, in most cases, when they do the follow-up, we apprehend the individuals. But again, it comes back to, are we really serving the needs of the community? So they get caught and they're convicted, but you're still a victim, especially if it's a tragic case like a murder or they're injured in a robbery. So what we're trying to do is reach out to the community for prevention, for them to prevent the crimes in the first place. But in addition to that, we're saying, look, an officer, because they're shorthanded and they rush from one thing to the other, can injure themselves or the public when they're responding on code. And day or night, it's dangerous. In addition to that, with the shortage, and as you heard the major say, more people are interested in swearing in and leaving our agency for the military reserves. It's demoralizing to the officers on one hand, so the stress level again rises. But the other thing is that they've been making apprehensions, for example, like the thefts of the copper wire. There was a plague of that, a sporadic thing, and then it's been, the perpetrators have been caught. The robberies, purse snatchings, that rose up, and then it was quelled. Now we're seeing it's burglaries. Some people reporting 5 burglaries. Okay, that's one thing. But then you have burglars who are there at the scene, and people are calling for help and saying they're right here, right now. And our officers are getting there a little bit too late. We get a description, we get an apprehension, but it would be better if we were there in the first place
like Senator Guthert said, visibility to prevent that from happening. Now we can't, visibility doesn't always work, as you, particularly senators that have been in law enforcement. But this we will do. We will do because it is a financial crisis that requires all of us to help out, but it cannot be long term. And whatever help else we can get from the community, and I'm also asking those that are in other government law enforcement agencies, join our reserve program. They get in a lot quicker than having to go through the full-on training. And yes, Senator Guthers, you're right. The training, we, ironically, are teaching it. GPD is teaching it. The university is benefiting from it, but then they put their stamp of approval that you're credited with it. GCC now is coming onto the bandwagon, which we used to be under GCC, and for the most part, and they're saying if you've taken the ICS, Incident Command training, then they will give us credits if we pay the fee. We like that. That's great, because now, although we have Doc Sanchez, we're not sending people up to the university or college and removing them from the field. They've already done their work online, and now they're getting the accreditation, just pay the fee. So what you just made me think of now today in this session is that since we're using our own people to train, we will train those reservists with our own people and then see if UOG and GCC will allow them to take care of any financial matters to just make sure that technically it's covered for accreditation. But that doesn't mean that we can't put them out in the field already based on the training they've received. It just means now that the college certifies for the purposes of DOA the minimum qualifications, that those two things tie together. But in reality, they've got the training, they're available, they're ready to roll. And so that's what I want to thank the senator for bringing that up and the rest of you. So, thanks, Chief. But this leads me really back to, it's really back to if the resources are not there, you've lost officers in the precincts and I'm sure in other divisions, and you have a moratorium overtime. What is the impact to our community as far as safety, as far as response time, as far as visibility, as far as traffic enforcement, as far as handling burglary calls and other crime calls? What is the impact? Are we serving our community? When we said the moratorium, of course, but it's with the understanding, and that's why we met first with the staff, and they're the ones that suggested these things. But we met with the staff so that we're perfectly clear, and now we're taking it to the where the rubber meets the road, where the precinct personnel understand that doesn't bar them from responding. It's just that they're making sure that they do this while they're on duty, and if it requires overtime, that they work beyond their duty time, regular duty time, that has to be acknowledged by the supervisor and for the reason of saving a life or being there to prevent something tragic from happening. Now, how do you differentiate or how do you determine which type of case would mean life or death? You can't in all cases. For example, a burglary, although it's considered a burglary, theft of property, but you got sometimes burglaries that are occurring when a family member is in that house, and so that could pose a potential threat to human life in that case. So those are high priority. Those are human life issues that we're more concerned with. So you're right, Senator. How can we address that? And is that saving the money going to save a life? No, we can't equate it to that. But we've got to look at those that are not in the immediate response to saving life, and they're burning over time. I'll give you an example. The recent close call with this Kong Ray. In the past, we would deploy a large number of our personnel, to include those in the administrative service in uniform and those in investigative, and go out and do anti-looting operations. We discussed it with the staff that we cannot do that, not only because of our crisis now financially, but we shouldn't have done it in the past anyway. And that may have contributed to our crisis today. Rather than sending them out, putting the cart before the horse, we will send them out when there is devastation and buildings are destroyed, power is down, and there are no security alarm systems working. And now they need to be enforced going out there with floodlights and what have you. So we minimize the number of personnel working in the command posts at the RAC or the EOC up at GIA, and the number of personnel that would go out and be deployed for that purpose. However, we instructed the personnel through the precinct commanders that they must ensure that they provide quality service and visibility prior to the storm, before the heavy winds and created problems with our power. But it was not easy. Believe me, this whole issue of saving money has been a challenge for us, but we're saying it can be done. We don't like the idea that this is the figure that is being placed upon us. We don't agree with the moratorium, but we placed it upon it's self-imposed, and we're hoping, because right now, as we speak, there's a CODEL here. That's very important, congressional delegate, and we are providing police services for them for their security. But as you know, it's mandated because of the simple fact that since 9/11, we cannot take the chance and not provide them the security and look at something in the aftermath of not being there for their security. So we're juggling quite a bit, senators, with the few that we have, but we will do our best to do our part. Kathy, I think we talked earlier about the COPS grant. Can you tell us about the COPS grant and the status of the funding from the federal government?
Actually, we had 2 COPS grants, and the COPS grants gave us 20 police officers starting off as recruits. And we had the 2001 COPS and we had the 2003 COPS. 2001 expired. We picked them up on this fiscal year, and they are under local funds. And part of the grant specs is we need to maintain them for at least a minimum of 5 years. They started it off. That was the SEEG money brought them on. So this year, FY 2000, the 2003 COPS grant is going to expire, and that means those other 20 officers will be coming on board under our local funds, but they will not begin until January 2008. And as for COPS grants to give us any more additional officers, we have not been afforded that. They've cut the grants pretty much.
Okay, what was the cost of each of those transfers from federal funding to local funds?
Actually, I was looking into that, and we spend per pay period close to about 15. No, I'll take that back. I have it here. I know it's more than $20,000 per pay period, and we're including benefits, night differential, and
For
regular
COPS
roll.
2001, and then another.
And then the other 20 will. We have them on the COPS grant right now. Our projections of expiration will be on December 31st.
I see a lot of problems everywhere, and I'm trying to help all of us understand that there are serious problems. And if you have a staffing shortage now, which is less than what it was a few months ago, and we're losing people to the reserves and the guard on deployments and training, and then we're not paying overtime. And then I see that we've already picked up the 2001 for this fiscal year, and we're going to pick it up next fiscal year for the additional 20 bodies. I have difficulty accepting any reduction in budgeting for this department, because it's an impossible task, in my opinion, and I wanted your input on that. Can we really do that without sacrificing the safety of our community?
Well, and that's a good question, Senator. If I could answer that, you're absolutely right. However, the department understands that if we aren't careful with what we're doing and try to match what is being presented to us, that it could affect the number of personnel that we can keep and pay at what we're paying, and keep them motivated to stay with us, because there are people that are saying, hey, I don't need this, I can get a better job somewhere else perhaps. But you're right, as far as that's concerned, then what do we do? Well, we're sharing with them this is temporary, and they're understanding that they're going to still work. We're doing collateral work all over the place. Everyone's an actor. I'm an acting chief. He's an acting, division chief overseeing. She's an acting division chief. We're all holding our own. But the question is, can we do it? We're saying yes. When it comes to financial matters, yes, we can hold back on the overtime. But say, for example, again, God forbid, a man-made or natural disaster. It was our own people that said, you know what, Chief, there's still too many people assigned to this typhoon assignment, even in the aftermath. 125 on the day shift, 125 on the night shift. That's too many, sir. And I'm saying, are you kidding? You've forgotten what that last big 2 storms did to us. 250 people, even if I merge them together, to manage 168,000, I heard was the last census, maybe not that high. But when they all have issues and there's no gas being pumped and they're forming lines and they're aggravated, irritated, and want to fight with each other, yes, you're right. We didn't have enough back then, Senator, when you were the chief. We didn't have enough back then before you were the chief. We don't have enough today, but we're going to make it happen financially. On the other hand, if anything were to set off our fragile economy and our fragile manpower lack of strength, we're looking at serious issues, and that's why I've spoken to General Goldhorn. What can we do with those that have sworn, even here locally, they're either with the Air Guard or National Guard or Army Reserve? What can you do? Because in the aftermath, if that storm hit, thank God it didn't, we're going to need them to be covering the traffic lights, not like what we've done in the past. And I guess the last one, Pongsona and Chataan, we switched off, but we can't do that anymore. The schools, just the two schools that were open for shelters. Thank God that our brothers in Customs and the other agency, I'm not too sure who else, Wildlife, they covered security for those places. The only thing we could provide was checking the schools periodically. But if you've ever been in those schools, believe me, it is not a pleasant thing, because after a few days, they begin to have problems. There's even criminal sexual conduct cases being reported, assaults, near struggles that could have caused a death. And so, you're right, Senator. So, what kind of answer do you want me to give you? I need help.
I'm confused.
I'm sorry. I'm
okay.
overboard.
So make it very simple.
Yes.
Can you operate or you can't?
We can operate
Okay,
like we
thanks.
have been doing. But
Thank you. Senator Sasaki, continue.
Thank you, sir. You know, there's a whole litany of questions I want to ask, but I'm going to try to keep it short for the benefit of all of us. And so, what was that resolution on the 23 cadets? Have they been hired? Did we put a freeze on the hiring? And did we put a freeze on the civilian dispatchers?
You mean under the miscellaneous?
To hire those additional dispatchers and to hire the cadets. Were those...
We're having problems with the dispatchers because we have the GG1s down at
DOA.
Department of Administration. People aren't qualifying, and it's maybe there's a part there of the qualifications. It's for an entry level. It's requesting too much that people can't meet that standard, and we're only asking for a law enforcement dispatcher at a entry level where we would train. So we need to take a look at the qualifications there again, go through Department of Administration and work with them on those quals, and it doesn't look like that they're going to be able to get on board because we would have to go through the process.
And then, Kathy, for the benefit of my colleagues, maybe you can just explain why the dispatchers are needed. We have police officers who are performing those duties currently, and if we have civilian dispatchers...
We're trying to get civilian dispatchers, but because we have law enforcement officers, our police officers, filling in as dispatchers when we have a civilian position, which could have these people doing the dispatch works and have our officers out on the street. And so that's why it was so needed to get the law enforcement dispatchers.
That's correct. And to pick up from Senator Judy Guther's comments about the police reserve, you know, currently the training standard requires about close to 700 hours of training, and how much time does that take? You know, I think Dr. J, you went through the reserve training a couple years ago, and how many months did it take to get through that training? Okay, so it's a rather difficult thing, and perhaps the stipends are not as attractive, and the assignments may not be as attractive anymore.
These people are doing it out of their love to save and protect the people of Guam. You're right, it's not. But it is a little bit for them to be able to buy a uniform too, because they don't get clothing allowance, you know, to buy their uniform. So they use that stipend to buy a shirt and a pair of trousers. And the rest they buy, you know, on their own. So yes, it is down to their own personal desire to help out.
Okay, I want to touch one more area, and then I'll yield to Senator Rory, and that's the area on airport facility that you occupy currently and the rent. And can you tell us the status of the rental agreement, and have we paid our rent?
Well, I'll just answer briefly and let Kathy get to the nitty-gritty of the financial figures and things of that nature. We have been meeting, of course, we had one meeting with you, Senator, in your office with Mr. Jess Torres, the executive manager, and his financial people. And yes, there is some indication that we owe them rent. There was some stipulation that in the past there was rent that needed to be paid, but then it was offset with some work. But then there was a document found that there was a carryover, that there was no need to pay any rent based on the fact that we are law enforcement and we provide a very critical service to the airport. So we're in discussion. I'm waiting for them to send me some documents that they wanted to send so that we can clarify some issues regarding that. But I'll defer to Ms. Kathy to answer the specific question of how much rent do we actually owe, or what the figure is that they're charging, and then have payments been made, and the other questions you had.
Actually, we are under discussion if we're going to pay rent or not pay rent. Airport charges us for the facilities $38,220 a month. We owe them approximately 1.1 if they say that we had to pay rent. But if the discussions go on between the Guam Police Department and airport, and that's amongst our attorneys, and they say that they're going to waive us rent, then we won't have to pay rent. But that's under discussion at this time.
So there are a lot of headaches going on, and I appreciate everything you folks are doing. And the kind of to synopsize all this, so can you really tell us that our public is adequately served based on the budget that you're given? It's a tough question. I know what you got to answer is going to be, but I still got to ask it.
If I could, and then I'd also like the Major to answer that, because he's really there with the men in the trenches. I was there, and actually I try to get out there every now and then, and they pull me back. They said, no, you're the chief now. You don't belong there. But let me just say, personally, no, I don't. I've seen the victims. I'm not satisfied. But I am more critical of myself and what I see. But how can we say, yes, we're satisfied? We're not. I'm not satisfied. And I know many of the troops are not satisfied, because even with the larger budget, by a couple million, it won't help us. We need the personnel, we need the bodies, then we'll cut down the overtime. And truly, many of the civilians too who would volunteer to work, but then they got some overtime, they're saying, you know what, we appreciate the fact that we aren't going to work overtime so we can go home and be with our families, for the simple reason that's why we're working. I mean, we're victims too sometimes. Our families can get hit by a car and that kind of thing. So no, to answer your question, I'm sorry, here I go again. No, sir, we're not. But the challenge is before us, and we're going to do our best, and in hopes that we are going to see something better coming. So I hope Japan signs off on whatever they're going to sign off.
Is that sufficient, Senator Sasaki?
Yes, sir. Thank you, Mr. Chairman.
Thank you.
And thank you, Rory, for giving me the time.
Senator Bishop.
Thank you very much, Mr. Speaker, and no problem, Senator Shizaki. You mentioned that you're going to have to pay me back one way or the other. I did it for free. Anyway, good afternoon, everyone. Your budget for Public Law 28-149 was $22.3 million. And how much of an allotment have you received to date? Most recently, just
11. Was it 11?
The total allotment released is $357,000.
Oh, I'm sorry.
What was that, Kathy?
$357,000 total on
Year to date.
To date.
You should have
I'm
received
sorry.
at least 11 million
Sorry,
if we're
wrong
going to go
one. That's
at
under
the
the
50% mark.
I believe it's 11, give or take.
It was about approximately 11.
11,000.
11 million.
I mean 11,000. 11,804,000 or something.
Yeah, so you've reached the 50% threshold
That is
so
correct.
far. The proposed cuts amount to $558,000. And Acting Chief, earlier you said that based on the cuts that the governor's proposing, you would be able to still maintain the present level of service that you're already delivering to the community right now. I wanted to ask you, so we have some semblance of comfort, on a scale of 1 to 10, what level do you believe you're providing to the community in terms of service in the area of public safety?
5. Although, but don't get me wrong on this. These officers are doing a great job with apprehensions.
Absolutely.
And providing the best service they can. However, we and me, from what I've observed, we would like to bring it up to a level. Did you say 1 to 10?
1 to 10.
10. But we cannot do that because we just don't have the people to put everywhere where we'd like them to be. So we're pushing for crime prevention, because at crime prevention, campaign, and people are responsible for themselves as well, then you'll see the drop in crime without having to put more police out in the field. But that's neither here nor there right now as far as the budget's concerned.
Would you say that it's because of the funding constraints that the level that you're providing is at level 5? Obviously has nothing to do with the professionalism and the hard work and dedication of the police force. And I agree with that assessment, Chief. And I thought that the fiscal year 06 and now the 07 budgets fully funded public safety. And so your response is very disheartening.
Well, and when we say fully funded to meet...
Well, I didn't say that GPD was ever fully funded. Those were pronouncements that were made.
Yes.
And so now I'm able to get the feedback from you to ask whether or not those pronouncements were true.
Well, and also, Senator, if we are going to be, looking at all the other parameters or realistic concepts on this subject, there are many things with modern police technology that are coming up that I'm not even aware of, but we're being clued in by our counterparts in the mainland. And it means that if we use some of these technologies, that we will then be able to see a decrease in crime because it works towards prevention. However, it costs money. And so to provide for those types of equipment or training, we're spending money in those areas, and that's where Ms. Kathy, I'm surprised her hair isn't as white as mine, but she is the one that is pulling and moving the monies to make the allotments work for us in the different categories. And so I give her a lot of credit for sticking with us to do this, because without her, you're going to see an acting chief that's just going to say, you know what, I know I really want to do it in my heart, but it's so tough that if I can't do it, I don't want to be the one responsible for people getting injured or killed out there. And I don't know if any one of you would want that, but Senator, truly, you're right. That is about where we're at, and we need to do something for the funding in the future to move the money more closely to public safety. Until this community gets on track with crime prevention, highway safety, we're at a loss right now. So,
were you consulted by the front office prior to the cuts that were proposed for your agency, or
yes,
did you?
We were, and if I could, real quickly on that subject, we went before them a few months back to discuss the concerns we had, and then we were made aware too that this is going to be government-wide, that we're not only going to be looked at from our perspective, that we need to do our own in-house tightening up of the belt, even though, I mean, there's no more tightening left. We're down to the spine. But we showed them at BBMR, Carlos, Joey, and I forget who else was in that meeting, the lieutenant governor and the governor at a later time, but also DOA, Ms. Cruz, and all of them had the same expression on their faces that this is a serious thing, but they are going to work toward helping us however that can be. And I think that brought about this situation where an executive order came out. But my concern was, okay, if you want, and if public safety is going to voluntarily do our cost-cutting measures, then we need to make sure it's going to be fair across the board for all agencies to do this, not only for furlough or prevent furloughs, but to ensure that our community is safer. And so that's why I appreciate what they're doing, but I also appreciate what's happening here today.
Let's just take that a step further, Chief, and that if the focus were not so much on the cuts, but
yes.
on the keeps,
yes.
then in some instances and in some agencies, you'd probably be able to realize more than 2.5%. In other agencies, it will be less than that. If the administration came to you and said, justify every single program you have, which would guarantee or almost guarantee the safety of our community, what would that mean? How much can you afford to keep? So that way we don't, at the end of the day, we don't compromise on the
yes.
education, health, and public safety the top three priorities that we all say that are our priorities in determining our budgetary allocations. You mentioned that 558,000 can be absorbed through cutbacks in OT and contractual fees. I want to spend just a little bit of time with you on the 7 internal cost-cutting mechanisms, or 6 rather, in addition to the 7 on page 2 of your memorandum.
Yes.
How far are you in determining the fees for police required for funeral escorts and special events? Item 1.
Okay, item 1.
Your memo is dated March 28. Have you already initiated some kind of fee schedule through the AAA process?
No, and I'll tell you why. Although we have a fee schedule that was presented by Ms. Karen, our Records and ID Section OIC, and Ms. Kathy, I think, presented that at some point in time to the former chief, even since that time. Maybe she can address the fees that we had looked at, and then I'll speak directly to the escorts.
And also, could you just answer, based on past experiences, how much would implementing item 1 yield on an annual basis? Do you know?
Actually, we have not done the numbers because we're looking at funeral escorts and special events. Special events would probably take on more officers, more equipment. Funeral assignments, I need to find out exactly how many people and how much equipment that does take to start working out the numbers, and I haven't done that yet.
And if I could, I'll give you an example. The carnival, from my understanding, the officers that are placed there to work a carnival assignment when it's peaceful, no riot, I think the cost was estimated at $20,000, just for one event. But that's kind of like a guesstimate. What we want to do, and we haven't had time because of this recent near miss of a typhoon, was to sit down and just concentrate on that those figures for you, because we want to know. And then it ties in with our fuel expenditures. When we start implementing the no take-home vehicles, then that will also be monitored on a week-to-week basis.
How about for item 2?
Okay.
The fee increases that you're proposing for police clearances, reports, and other licenses issued by GPD.
Yeah, actually, we had been working with that with BBMR because by law there are certain areas that we can increase without going through AAA because it's already within the budget, and there's some things that we need to go through AAA. And I had been speaking to BBMR about re-implementing or taking a review of those fees. Actually, as of yesterday, we started working on taking a review of fees again and what additional services we're providing and need to provide for fees, but we haven't completed that either.
Have you quantified what implementing item 2 would yield? How much?
No, that's what she's saying. That
no, we did that about a year or 2 years ago, and it wouldn't be no more than $200,000 maybe.
But that's about $400,000 already if it had been implemented 2 years ago.
Yeah.
What was the problem back then when you say you have the administrative authority to do this without any legislation or even without having to go through the AAA? What prevented? What happened 2 years ago where this item 2 was not implemented?
Actually, we were putting it through, and I don't know what happened. It had stopped, so now we just want to readdress it.
And I think at that time we weren't facing, or we weren't aware of the crisis that we're trying to address today.
Oh,
Not that it didn't exist.
We had this crisis for quite some
Yes.
time now, and don't get me started.
I understand. Yeah. And like I said, even GPD contributed to probably our financial decline because we were putting people out where they shouldn't be. And, at that time it wasn't really studied as far as how we play a part in the financial scheme of things to that extent to where we are today. And we're saying we're going to correct it. We are correcting.
And you know what, Chief, what I'm hoping to see, if you're ever able to implement these 6 items which would generate money for GPD, I'm hoping that the government or the folks who manage the purse strings don't see GPD as their ability to generate revenue so that the general fund size should be lessened. I mean, you're doing this to get your level from 5 to as close as to 10, if at all possible, which it really is possible. Kathy, you wanted to say something? I'm sorry.
Yeah, you know, when we're addressing fees too, it's kind of a delicate situation because when you're looking at the way these employers are asking for police clearances, and I understand why they need the police clearances, but you have about 20 applicants for a position. Every one of them have to go and get a police clearance, and then they're standing in line and they put in their police clearance. That was $5 out of an unemployed person, and they keep going in and putting out these police clearances and keep coming back. And you're asking the unemployed to keep coming up with
You
these
charge $5 per police clearance?
Per police clearance.
Hasn't
So-
anybody ever thought of maybe a $5, whatever it is, of initial charge and then charge for copies? So if within a certain...
and we were looking at charging it copies for $1, but we're just saying that, you know, do you really want
So you don't charge
do you want to
$5
charge
every-
the unemployed $5 for a police clearance every time that they want to apply? And then it's up to the employer if she's going to take the original stamp or a copy stamp. You know, that's not our call. But we're just saying that sometimes maybe it needs to be reevaluated. When does the police clearance need to be looked at? So we don't want to go and raise police clearances to $10 to somebody that has no income.
And she's right. That's a better answer than what I gave you, because truly there's a human factor to this whole thing. We're not the only ones suffering from financial crisis, the general public. However, you know, for example, the sex offender registry, in order for the government of Guam to identify who those are that are on that or should be on that registry, we're going to have to be producing police clearances for all these people. Well, our attorney, Jim Mitchell, came up with an idea. Rather than doing it specifically for that reason and in that fashion, let's just narrow it down to who have an issue, and then let that agency know by, you know, some method that, rather than, you know, issuing everybody police clearances, will save something in that nature. But the other thing is that we're looking at how much time it takes and the effort and energy that the few people that we do have need to be putting into investigating and looking through the files to do these police clearances as well. But then on another note, the irony is that people that are already victims of crime have to line up and get an abstract of their report. So, you know, again, like she said, are we overburdening our community to be paying for these police clearances? On the other hand, how do we balance it with how much we expend as an agency? Because we're a line agency.
I mean, I agree it's a tough call, but it's those human factor that we continue to take into consideration that attributes to the overall degradation of your agency's mission.
You're right.
And so with item 4, 5, and 6, it's the same thing. These are items that you're pursuing?
Yes, but you know what? Both you and I kind of skipped over item 3, which I think is really important. Item 3, I've asked many... I'm sorry. Okay, should
Please,
I go back? Okay. All right.
When you're asked a question.
Okay.
Just
all right.
Go ahead, Chief. Item 3.
All right. Item 3.
I'm sorry, but I have to set the rules on this.
Okay.
So,
all right.
You know, when you ask a question, the question should be answered to you accordingly.
All right.
As asked.
You're right.
No, I agree with Mr. Speaker.
Otherwise, we'll be conversing here the whole day, sir.
You're right.
Anyway, Senator, you got the floor.
Chief, did you want to speak on item 3? I have a question. That's my question.
Okay. Item 3. Am I violating anything?
Go ahead.
All right. Item 3. Many times I've requested for help in this area, and now the court is listening. Mr. Dan Tydenko is going to look at this together with our chair, Senator Ray Tenorio. Item 3 deals with citations for misdemeanors. In the mainland, I saw that small counties, like the one I worked in Oregon, that they were able to fund many of the things that the public safety officers needed, the sheriff's deputies, because the citations were used to buy equipment, pay for training and supplies. That helped the county commissioners to use the money to pay salaries and overtime. Citations for misdemeanors means that when, for example, an individual assaults another individual and there is minor injury and it's not aggravated assault, they both get a ticket if the other person struck back. They go and pay the fine. It could be anywhere from $250 up to whatever the minimum is or maximum for a misdemeanor. They don't have to go to court or be arrested. Second offense, same thing, but however, by the third offense, now something's wrong and somebody has to stand before a judge. They generate a lot of money. In other words, they're making crime pay. If our community were to adopt this type of method of dealing with misdemeanors, like a CM, somebody breaks your window and we catch them, rather than lock them up and throw away the key for a while and put them through the court process, the court saves money, DOC saves money, the police save money, money goes into the general fund, and then that can be used. Now, I know we're not here to try and help the general fund necessarily, but I'm here to say that that's an idea that we need to pursue. And I'm sorry I jumped to 4, 5, and 6, but I don't know why I missed that one. We put it down, but I kept skipping over it. But
Chief, but the bottom line is you're going to do more than just propose these things.
Yes,
you're
sir.
finally going to implement it.
Absolutely.
And just a final question. We got a presentation by the administration saying that the governor ordered salary reductions for all cabinet officers, and that was to be effective April 1st. I'm sorry to have to ask, Chief, but did you receive a 20% pay cut?
Actually, yesterday I asked Miss Kathy, what am I getting? Because as an acting chief, I think I just started getting a detail pay for the chief's position. I'm not sure because it wasn't that big of an increase. I've been getting captain's pay for the last 10 years, and I've been doing the work of a major for quite some time. So every now and then when somebody asks me, hey, have you been promoted? I think about it and I say, no. And I don't qualify for major, but I now qualify for chief of police.
But you're considered as a cabinet officer right now.
I understand.
Correct?
So if they did cut me at whatever I'm getting now, whether it be the captain's pay that I just started getting, like the new captains, I'll take that. But I've also got to consider what is going to benefit my family if I can keep my family fed, like
my point in asking, and I'll wrap this up, Mr. Speaker, is that the governor has said that he ordered these things to be effective April 1st.
Okay.
And so I'm just asking whether or not these policies that he said that he was going to do, if he did it. So maybe the ASO.
I don't know.
Was there a personal action
cut?
cut?
If it was effective April 1st, I wasn't aware of. I've heard of it. I haven't seen the documents to enact it, but that's April 1st. That will be this coming payroll.
Well, he said
but it hasn't taken effect yet.
He said by doing that and by doing a 10% of all of his unclassified employees, he would realize $1 million savings in the next 6 months. So I just wanted to know whether or not that policy went into effect.
I think that has been answered. You can tell.
Yeah. And I'll just close by thanking the acting chief for being very frank and for telling this legislative body that the current level of service is at a 5 because of financial issues. Thank you, sir.
Thank you, Senator Palacios, then Senator Barnes, then you.
Thank you, Mr. Chairman. First of all, of course, I'd like to point of clarification that the budget for GPD is more than 22,346,896, and that is, of course, looking at the previous budget, or rather the current budget documents. There is also $370,084 from the police service funds, and then there is the $546,918 from the federal matching grants and aids. So the cut actually is proposed to affect only the general funds. And so it is more than 22 million. Actually, the total authorized budget for GPD is 23,263,988. But that's just a clarification. Now, my question is, this has to do with cost cutting, and I'd like to again go back and be more familiar with this employees of Governor Guam, and in particular GPD, who enroll in the Army Reserve Program and those things. And the Major is here, and he can explain. First of all, Major, if I'm not mistaken, you are currently a member of the Army Guard or whatever they call that?
Yes, I am.
Okay. So, for my benefit, please, I understand that there are two ways where a member can be deployed, and one is the mandatory deployment, and the other one is voluntary deployment. Are there such things?
Yes.
Okay, the mandatory deployment for employees of the government of Guam Isn't that the 1 month per year and 1 weekend every month?
No, currently the National Guard has a mission, and they do a rotation of personnel to accomplish this mission. And if your unit is out for the rotation, then that's a mandatory deployment. If you serve on a mission already, now it's required by law to federal statute to give you a couple of years off, but you can volunteer to pull another mission.
Okay, so my point now is this. I understand that those who are deployed under the mandatory provision, they at the same time are on paid annual leave from the government of Guam?
Yes, sir. If they have sufficient number of leave to cover certain numbers of the month within their deployment month. But I doubt it if they will have enough leave for 18 months. In doing so, they sometimes will request for shared leave.
Okay, those that are on voluntary leave, is the government of Guam mandated to pay them, to allow them on a voluntary deployment with leave with pay? I understand that the government of Guam is not obligated. That's my understanding. In other words, those that want to volunteer, provided it's approved by the chief of police, they can go and volunteer but without pay. Would that be improper or not? Of course, I'll check this later on. I'll
Yes,
verify this with the...
If they volunteer for a second deployment,
Yes.
by them requesting to go on annual leave, we have the discretion whether to approve the annual leave or not.
Would it be against the law not to approve?
We could disapprove their leave.
What is the practice of the Guam Police Department in a situation like that? Because I understand there are not just the Guam Police Department, but the entire government of Guam. And this again, this is beginning to really put a burden on the people of Guam by having full-time employees on full-time payroll who behave like part-time because they go on full-time with the military. And I have no problem with that, except that this government is suffering. I mean, and those that stay behind would have to pick up the slack and be burdened because on this voluntary deployment, they still sign off and be paid annual leave. And of course, if I'm a member of any government of Guam agency, I will go ahead on a voluntary deployment because I'll be drawing 2 checks. And especially with the leave borrowing and this and that, there is problem there. And I repeat to you, there is problem there. And that is one area that right now we can make a difference by just saying right now all leaves will be disapproved of on voluntary deployment. If it's not against the law, and I don't think it's against the law. What is the practice of the Guam Police Department?
So far, we haven't seen that situation. Those that have gone on military leave, maybe a second deployment, they have taken the annual leave, but that was before this situation was brought to light. But because of exactly what you're saying and something I've discussed with General Goldhorn, and he's agreed with pretty much what you're saying, that that should not be the case. And if we can, together, we will resolve that based on the fact that although there are some now swearing, and we can't stop that part, but to make sure that the people of Guam are not paying for these folks that might what is the word, Major?
Voluntary deployment.
I know, but they re-up for a second term, a second tour, which the military is not saying that they're required to do. And some a third, I think, but I haven't seen that in our agency. I heard that other agencies. So based on your question, I will have to go back with the Major and to the precinct commanders and identify who that are on military leave right now. And I've asked for a calendar, military deployment calendar, so that we can study who are doing these things and then stop it. But I can, based on your comment, put in writing in black and white that we will make that a policy, that there is not going to be any further action of that type.
You know, this is widespread within the government of Guam, and who is hurting except those that stay behind? And you know, there's even an incentive to go on voluntary deployment because then you're drawing And not at a time when I know you're very short. I remember almost 20 years ago, when the uniform personnel, the uniform position was over 400. Now it's under 350. I mean, how can we go backwards? And that's one area where really you can do immediately, take action on your own internally and begin to get control of this, because times are hard, and we don't have to lay off or cut off or sacrifice. Just have those people come back, or rather don't approve leave with pay on a voluntary deployment. So they have the decision whether to go leave without pay or stay back, and I would venture to say they will stay back. So that's I want to clarify that. On the issue of fees, I am beginning to introduce fee adjustment, in this case for the Department of Revenue and Taxation. And what I did is I took Bill 199, which was introduced last year, and I broke it up into several bills so that way we can focus on these fees. And I offer my office advise or instruct your legal counsel to prepare a bill in a bill form, and I'll put my name to it and I'll introduce it next week. We don't have to go through the AAA process. Those fees have been discussed before, and there's reasonable, I guess there's a reasonable acceptance, or rather satisfactory acceptance of that. And again, the public hearing that will come about to hear that bill, then everybody would have a chance at that point. But we're not going to dwell too much on who supported and who is not, when really there is a process to do that, which is the public hearing. So when you can finalize that, then I'll introduce the bill. I have no problem with that. But, how much does it take, by the way, just an example, and then I'll conclude my point. How much does it take to produce a police clearance? Everything, manpower, paper-wise, whatever.
Well, actually, if you're asking for time, maybe 15 to 20 minutes, they need to pull out the individual's record, go and identify the record, find the record, ensure that there's...
So 20 minutes per process, plus of course the paper
of course,
there.
The paper, the Xerox, the copier.
How much altogether probably, including of course personnel hours? So actually, can I say then that you are charging, that the government of Guam or the people of Guam is subsidizing the fees for people that come with it? And that's one of my main concern, is that at least the government of Guam, the people of Guam should be allowed to recover at least 90% of actual costs. Because I know we're not recovering not even 50% of actual costs. And that is where the deterioration of the revenue, begin to occur. So again, I am prepared to introduce a bill to raise and increase the recovery rate of what it takes now to provide those services. Thank you, Chief. Thank you, Mr. Speaker.
Okay, I'm calling a 5 minutes humanitarian recess. 5 minutes recess. Thank you.
Muñoz. Thank you, Mr. Chair.
I didn't
really
see the hyphenation, so I apologize.
That's okay.
Senator Bond.
Thank you very much, Chief, and to Kathy and to Captain Rick. Thank you very much for being here this afternoon and sharing with us this full length of presentations. I've learned a lot this afternoon, and one of my colleagues talked about getting creative and thinking outside the box. Kathy, uniform personnel today, and as far as police force, we're at number 100? 340, right? $306 uniform personnel. Okay. And out of that, it was also noted that the reserved, those in the reserves, whether it be Army or Air National Guard or Air Reserves, the number there is at 70?
7375.
73 to 75. And out of that number, Captain Rick, how many today as of today, are deployed or doing military mandates here on Guam or what have you, out of that 73 to 75?
Senator, as we speak, there's approximately 15.
50 or 15?
115.
1-5.
Actively deployed to. I'm sorry, I take that back. 17 deployed to the South Asia. And we have other deployments here locally with the Air National Guard. And we have like 3-4 months deployment to other parts of the United States. Those who are with the Air Force Reserve, who usually between 3 to 4 months of deployment. And then we have about 3 more that will be going to basic training at the end of this month.
So out of the 70, you can guesstimate maybe about 50 that are off, like not at GPD as we speak.
We can say roughly about 35 are on deployment or are scheduled to be deployed in the near future, either for training or for their annual tour.
So that just brings to mind just knowing the answer, Chief, to that, and being creative and thinking outside the box. It was noted by my former colleague earlier, Senator Izazaki, about the police reserves, and I know that Senator Gothard spoke to that, and just wanting to get a better clarification and maybe something that maybe we can look into and work into is what are the current incentives to become a police reserve officer? I know that it was mentioned about 700 hours or so, but what are the prerequisites or incentives right now to become a police reserve?
Of course, one of them is the fact that they can serve the public in that capacity and receive training and be a part of the community, the law enforcement community in that regard. The stipend wasn't always the attractive factor because sometimes they weren't getting a stipend. I think it's 250, 42. Kathy can answer it more directly because she's the one actually identifying the figures and the payout, the checks. Do you want?
As far as the stipend is concerned, ma'am, the police reserve has to perform 42 hours per month to get a $250 stipend.
250?
Yes, to be in the program itself, you have to meet 20 hours, minimum of 20 hours, just to be in the program without any stipend.
20 hours. Okay. And Chief, just being able to answer that, what would you suggest as an added incentive to increase the police reserve officers? And I ask that most sincerely because it's important that we really get creative and think outside the box and maybe wanting to know what the benefits are, what can we add to make it more attractive to them so that they can, you know, I know a lot of it's labor of love, but what can we do to make it easier on our end?
Yes.
Because of what we're up against right now in this crisis.
We've had a meeting prior to Senator Ishizaki becoming senator while he was a chief, and we got the group of reservists together that could attend that meeting. And they were saying some of the things that you're saying, and I don't have that list with me right now, but one thing that they were interested in, it means maybe not much to some civilians that aren't in the military or in law enforcement. If they can wear their rank insignia, like the 2 stripes at the very least, for those that have been in the reserve program for maybe 5 years and above. The reason why their rank was taken away is because when you get 2 uniform officers out there, one's a reserve officer, and he's wearing a captain's bars, and you have a regular officer who has maybe 1 stripe, and you see the captain directing traffic and the uniform officer not, that is a regular officer, then there was some question as to what's going on. Isn't there a rank structure here, and why is the captain directing traffic and the regular officer with a 1 stripe? See, because the public doesn't understand who's reservist and who's not. So we even discussed give them the rank but change the patch or add to the patch or the badge reservist, and I think they do on the badge already say reserve officer. I'm not too sure, but I haven't looked at one lately. But they were saying that they agree that at least 2 stripes would help them
within their own circles to show the new reserve officers that they are the ranking or the reserve officer that has some authority as far as time and service. So we agreed. The problem now is that all kinds of other priorities came up and that got put to the wayside. But it hasn't left my mind because I truly agree that that is an incentive. What would be a nice incentive too would be to raise their stipend. The uniform allowance for regular officers is $300. But then when I look at Miss Kathy and say, can we do that? She's saying, are you crazy? Well, right now, yes, we'd like to do that, but you got these other priorities. So when we were looking at stopping, now that the senator provided that idea of maybe putting out a policy, no one sign up if you don't need to, or not sign up, but go on leave, we're also looking at that. Now I lost my train of thought. I'm sorry. Oh, I got it. Training. People, there's all kinds of training that we need to be sending our people to off island, but it requires the travel per diem and things of that nature. So we've already restricted that to the bare minimum that need to absolutely go, especially when they've already paid for that training themselves out of their own pocket, because they saw that it's important for law enforcement needs here on Guam to include some of the more technical training with regards to the new technology that we'll be bringing on board, the AFIs, which we've had in the past, but this is the updated equipment. They need the training. Ms. Karen is slated to attend a training with regard to the New World computer systems, because we're seeing that that is very beneficial to the community. So, and then there's other trainings, but we're having that done here on island rather than sending 5 or 6 people. So I think even the training in New Mexico with regard to WMD and radiological effects and that type of training, we've reduced it to ensure that although it's federally funded, correct me if I'm wrong, but we do have to pay certain aspects of that training. So we're guarding ourselves against sending off people, besides the fact that not only is it financially hurting us, but physically our personnel are distributed here and there. So I've requested 3 things to clarify for you also, so you can see it, and we're not going to give you a rough estimate. A deployment calendar, a training calendar, and other events calendars, so that we also can monitor where our people are when they're coming back and how much it's costing for their travel.
I think, Chief, that it's really important when it comes to looking at the incentives and bringing to the forefront of the police reserves and trying to get more, even the young ones, from the community into play, and maybe Senator Guthrid's suggestions of even looking at the qualifications with education and bringing some kind of MOU with the community college or the university to bring that to the forefront, so that maybe we can add on to the reservists that we have today. I understand on the reservists too, and as far as when they're on duty and pulling that minimum 42-hour work week in order to get that stipend for that month, are they on any other medical or dental benefit, or is it just that stipend?
Just a stipend, ma'am.
So, Chief, for the recommendations that were brought up today, I just think it's really important that we look at that avenue again, we visit it, we check it, and maybe even look into any more grant funding out there, so that this police reserves can get that limelight when it comes to being able to share that labor of love, what they do for the community. Because I understand that the officers we have today, we're at 20, right, on the police reserves?
Right, 20 active.
Active, and the minimum years of all of them, nobody has been in less than 5 years. Am I right?
Yes, we do have. We have a couple of them over 5 years, but we do have some that are
just
new.
Coming?
Yes, new CVPRs, police reserves.
And have they got their training here in Guam?
Yes, ma'am. Yes, ma'am.
Okay.
I will do that, and that's good to know that, somebody has thought of it, I'm sure, but we haven't pronounced it and made that happen. I will go back and do that. And the other thing is, what's interesting, though, is many of them come from law enforcement agencies already. They are getting benefits and things, but you just struck up a good point that there may be some that aren't on that list, that are on that list of reservists that don't have those. So we'll go back and get more intimate with them regarding their financial needs and what we can offset with maybe medical or dental. We can talk to
including the uniform to that effect.
Yes, ma'am.
But thank you very much, Mr. Chair, and I thank the presenters for being here this afternoon.
Thank you.
Jesus Masi.
Senator Pangilinan.
Thank you very much, Mr. Chair. Just a few questions. We look at where we deploy our resources. I guess limited as they are with regards to the budget of the Guam Police Department. I kind of note a couple of things in the staffing pattern reports that we get, Kathy. It seems like there's under the COPS program, there's a sheet for the COPS program that's 100% federally funded. And in there you have, your overtime, your night differential, your hazardous pay, and all that. And then there's another sheet that have the same names with no entry other than overtime in that staffing pattern, but they're all the same people. And but they already have overtime in the other sheet. So from this, it looks like we're kind of budgeting for overtime twice for the same people.
Yeah, actually, we were supposed to take the overtime out of the COPS. Overtime is not federally funded. It has to be locally funded.
Right.
And those officers that are under the COPS program still make overtime.
Yes, I know.
So that's why we put it under the local fund, so that we make sure that we budget for their overtime. I need to take that part out. I'll need to correct that.
But if I add all this across, does it come out to that?
Yeah.
Does it include the overtime in the subtotal?
And that's the part that I'm going to need to take out.
So you need to correct that.
Yeah, I need to correct that.
Okay. Now, the other thing is, I just wasn't sure, what is the additional 6 hours special that seems to be in all the positions? And that's...
Sworn officers get paid 43 hours a work week, so the 6 hours is additional...
Per pay period?
Per pay period.
Okay.
Yeah, and it's at regular rate.
And that's by statute? By Fair Labor Standards?
Yes, by Fair Labor Standards Act.
Okay. So they get the 43 hours. In addition, they get the hazardous pay. I thought that when the Hay study was incorporated, or they did the skills and job descriptions, that the police officer pay scale included the hazardous pay as part of their regular base pay?
No, actually, the TOE is presented to the legislature. The TOE identifies, but it did not include the hazardous. Hazardous is not included into the police officer's regular pay.
So you have to budget for it separately.
So we budget hazardous and then determine the percentage amount.
Sure.
And so that's what they're getting at this time.
Okay. Now, so there'll be a little bit of adjustment here where you can, I guess, cover the $500,000. There's $45,000 in that double booking there for overtime. The other thing is, I wanted to just clarify that the cadet program, which is funded by a separate appropriation, is contained in Chapter 6, Section 3, Number 6. Is that correct? Is that the appropriation you're talking about?
No, I was looking at the appropriation where it's in Section...
yeah, it's in Chapter 6. It's in the bill. It's in Chapter 6 of this bill?
Yes, Chapter 6
Chapter 6, and it's
in the miscellaneous?
Miscellaneous.
Number 6.
Number 6.
Correct.
And that's the GPD appropriation. Now, it said here that it's unencumbered or unexpended. Now, are you going to bring these individuals on, you think, before the end of the fiscal year?
Actually, if there's already 5 officers being paid out of that account.
Okay.
Under the contractual.
Over the 23.
And they're processing, and we're hoping to have them on board within the next 2 to 3 months.
Okay.
Yes.
So if you encumbered them, then there's no question that those funds will remain and will not revert to the general fund. So I just wanted to bring that to your attention, that we don't necessarily have to delete it out of the bill. If you encumber them now, because you expect to bring them on, that they will remain with the department. Okay, so just to make sure that it doesn't happen that we take those out, you have these individuals ready to come on board, and there's no appropriation to pay for them. The other thing that I wanted to kind of, we're trying to take a look at this issue of new fees and so forth, and none of this would really affect the current resources available to the department. I mean, these are all future resources that would come to the general fund, or setting up a special police fund and so forth. Now, there's one police fund, which is the
asset forfeiture.
Asset forfeiture. Now, the last time I looked at that, there was about $160,000 in the account. Is that being utilized to provide training, or what is its main utilization?
Actually, the utilization, we're directed on how to use that funds from the federal asset forfeiture. The majority of that is for equipment and training.
Okay. All right. So there is a fund that's available. It's not part of your appropriation, but it's specific special fund for use by police services. So there's one area, I think, which you could supplement, some of the free up some of the money for equipment and training, and what you would normally use out of your general fund appropriation cover some of the other operational expenses. We talked about this police report and thinking about raising that. Kath, I agree with you, and it really is a burden on employees, interested employees out there applying for jobs in the private sector. We may not think it's much, but I know individuals who apply for 3 or 4 jobs a week. They don't get hired, but that's $20, $15 every single week. And the employers won't accept a Xerox copy. And what I've suggested in the past is that perhaps the police department can give certified copies at the time that you issue an original. The employers want originals, they say. And maybe you can just develop a system where you make a copy and you give the guy 4 copies, and stamp original copy or something, just to assist these individuals, because these individuals are serious about getting jobs. The economy has not turned around. Jobs are hard to find. I know everyone out there says jobs are easy to find, and that, you hear the chamber and so forth, they're saying, they're all looking for people. But I'm telling you, there's some serious people out there looking for jobs, and for whatever reason, they're not able to get them, and they're spending $20, $30 a week sometimes, or a month, or every 2 weeks to apply for jobs, and they just don't have those kind of resources. It really is hard. And so just a quick calculation on what it would cost for the police record even. I looked at the police record section, took the lowest clerk, he said maybe about 15 minutes to complete it. They're making $7-8 an hour. That's $1.75 for a quarter hour, and then another $2-3 for overhead costs. $5 is about right. Might be overcharging the public at $5, But so this idea that, man, it's too low, the chamber can do their own analysis, but that real quick analysis of time motion study will show you that it's not that out of the realm, and we're not giving it away. That we are getting a portion of that. And so, I'm concerned about that, and very much so. The other thing, of course, looking at the staffing pattern and the departments and agencies, and, we have to think outside of what we've normally done. And I look at executive detail, and I look at the cost of executive detail, and our cost for executive detail is over close to $1 million a year to protect, 10 people, maybe under the executive detail service. That's $92,000 per person a year that we spend for security. If we take a look at the $21 million remaining in the GPD budget for the remaining 150,000 people in Guam, we're spending $1.42, per person per year to protect our public. I know we have an obligation under executive detail, but somehow we have to rein in that cost. Just as you're looking at civilian dispatchers so that you don't tie up uniformed personnel that could go out there and have the capacity and the skills to protect the public. Somewhere along the line, we've got to take a look at executive detail and put a different mix of skills there, or maybe a different mix of civilian front office staff with supervision by GPD personnel or something. But really, when we're spending $92 per person under executive detail, and we're spending $1.43 per person for the rest of Guam, we've got to think outside the box and try to bring that into balance. And Chief Suba, I'm going to ask you this, just as I asked, Art. We're looking and we're struggling to find and ensure that we have the resources in the department. We're short-staffed, we need people, and so forth. But again, I'm going to ask this straight out. There's no nice way to ask it, Chief Suba. I understand, did you recently hire somebody to work in the admin side in the chief's office, coming out of Guadalupe again, or the office of the governor, or one of the executive office branches? That, again, it just seems like we have a shortage everywhere else for the resources, and that's where we decide to put the resource because of a direction from the top. And if that's happening, then I think we have to, again, re-examine all of these things that we're saying that we don't have the resources to serve and protect, and we're putting it in a resource that is not directly to that.
Did you want me to answer it now?
Absolutely.
Okay. On that question, and then I'd like to go back, if it's okay, with the chair. Yes. The situation that I face with regard to the mandate to open our record section from 7 a.m. to 6 a.m., 6 p.m. We are unable to meet that mandate with the shortage of personnel within the record section. So I made a request from anyone that would help to send me someone that can help in that capacity, barring the hiring restrictions on clerks and what have you. Whatever we could do, as you said, thinking out of the box. I approached the governor that I needed help with this, and there was, I believe, assistance that was going to be provided from the hospital at one point, that there are some people that have that capability to work in that capacity as well. The other concern I had is I have two, I don't think the major has a secretary, the colonel has a secretary. In the chief's office, we have two people that function as administrative secretaries and to be able to address internal, external information and activity related to the department in general. The one person that is more or less collateral as the receptionist and dealing with internal matters, Ms. Bing Bouquet. She has now been tasked to help out with the upcoming Top Off 4. She is absolutely needed to help the department to deal with all the meetings and information and so on and so forth. So she is also trained and able to help out at the record section. At times we've had, like Ms. Neng from our support division, she's the secretary there. She voluntarily goes and helps at the record section at the busiest hours or time frame. Some have been pulled from Crime Lab to help out there. This particular individual, when she came over and they stated that she would be able to help out, and she had understood the need for someone at the record section, accepted that responsibility as well. I have a secretary, Susan Regis. She experiences carpal tunnel problems, so every now and then she's not in the office. So when Bing is gone for Top Off 4, Miss Susan Regis is not there because of sick leave reasons. I have no one. I can't pull from the others that are already helping in records. This individual, is it okay to say the name?
It's up to you.
Well, there's nothing to keep confidential regarding her position or her name. Miss Wong is over there helping or learning how to help at records. She had to have a background check and all of these other things. However, in her background, we were able to identify that she is a 368 MP coming out of that process, she's going to not resign, but what do you call it? Permanent transitioning out of military service. And she has the background expertise as not only a secretary, but to work in all those other civilian functions. Just to give you an example, the recent close call with this typhoon. I'm sorry. Go ahead.
Chief, let me just.
So I accepted her. And,
So you
and we went through the process of hiring. Yes.
So you hired a position in your office.
Yes.
Coming out of the governor's office.
I didn't know where she came from at the time, but then I heard that that's where she was originally located.
That's all.
All right.
Thank you very much. And again, it's just that, it's these kind of incidences that just, again, it may be small, but I tell you, it demoralizes the troops there, Chief, because they know. I mean, it's just somebody sent down from the front office. It's a pure and simple. That's how the troops see it. The position's not announced. Nobody gets to compete for it. It's just sent down there, and a place was made for them. That's how people perceive it. That's what we're told. And quite frankly, it's hard not to see it that way. And I just think that, when we're struggling for all of this and we're cutting salary, we're facing furloughs, we're facing budget cuts and so forth, and we make something like this happen. It doesn't happen in the normal course of things. It was made to happen because it was from where it was coming from, and that's just it's not that good. It doesn't appear that well, and I think we have to deal with what it appears to be. Thank you.
Senator Cabo, you're recognized.
Yeah, thank you very much, Mr. Chair. Mr. Chair, going back to the memo put out by the chief to all personnel, second page again, and the question was brought up a little bit earlier in 1, 2, and 3. These are for services and fees, and also citation for misdemeanor program. You made I think there was a number mentioned about $200,000. Is that how much do you anticipate from if there's implementation of these services and fees and citation for misdemeanor program? How much money are you anticipating?
When we were looking at the increase, we were anticipating approximately $200,000, but that was more than a year ago. If we raise certain fees, what would it generate? That's what we were looking at the time.
Yeah. So is this
right now we're pulling about $300,000 per annum.
Yeah.
And so if we increased it to the certain increases, then it would be additional $200,000. So it would be approximately $500,000.
Okay.
But we never implemented any increases.
Yeah. And
so now we're actually, I had just been working with Records and ID at looking at the fees, and we want to revisit that again because there's additional.
You just mentioned BBMR. You just mentioned you were working with BBMR.
I was working with BBMR at that time.
Okay,
because we were putting in what we would feel that where increases could be used to for fee increases. Yes.
So how long have you been working with BBMR on this?
Oh no, that was at that time. That was approximately about a year and a half ago, 2 years ago.
So
but we're not working with them right now. I'm working with Records and ID because we want to revisit that fee increase and start processing.
The question I have is, the governor made mention that fees, a reevaluation of fees and services provided by the government of Guam was going to be a portion of revenue enhancements as we move forward. Again, we were originally anticipating it in this particular Bill 74, but the only thing that we received was the increase on the GRT to 5%. So has there been an active coordination with the front office, BBMR, in this fee?
Not what I'm looking at right now. No,
also,
I haven't.
So,
I did this before.
Yeah, but let me continue. Let me continue.
Oh, okay.
Thank you. I do know that the administration has stated that there is going to be they will be sending over, again, proposed fee increases. So obviously you haven't been advised of that at this point.
No.
So you've been working this independently?
Yes.
Okay. With working independently, what were you to do when you've completed? How long before you complete this evaluation and you have something ready?
Well, actually, I was trying to work with the Records and ID manager, but because of our other duties and responsibilities, it's been quite difficult for her and I to be getting together here.
So when do you intend to complete this evaluation?
Well, maybe another 30 30 days.
30 days, okay. And so I'm anticipating, has this been brought up to the administration?
Not at this time.
Okay.
Because I'm looking at what I want to do is I'm trying to address what services do we give that we're not charging for, what services do we have that we can increase without going through AAA, what services do we need to go through AAA if we wanted to put a charge. These are the things that I need to measure or take a look at, and the best person to work is the one that runs records and ID.
Yeah, no, I'm actually, I applaud you because again, the police department is initiating by their own momentum and motivation, a reevaluation. I figured that as we see these things in the memo, is that this was part of the administration's reevaluation of services being rendered by the government, as well as reevaluation of certain fees being charged. So I anticipated that this would be present, and I do note that they have stated that they will be presenting something for FY08. I have no problem if it was presented for FY07, but no, kudos to you. So really, what's occurring now it's all been the brainchild from you folks, and you will be presenting this thing to the administration, because obviously you'll want the administration, the governor, and BBMR for their for their stamp of approval, correct?
Of course.
And then, of course, with that, it will whatever you recalculate, that will be part of the revenue picture as well, correct?
Correct.
Okay. So again, Paul, I'm requesting then that what you need to do is get these things. If you can do it faster than 30 days, fine. But I think it's important that you do correspond with the administration. We had Mr. De La Rosa here earlier, and of course we've had representation from the administration that there would be a package coming along. And what I don't want to see is here we are entertain a package, and then lo and behold, 30 days later, the police department comes in and was not participatory. So, okay, if you could work with the administration on that. Thank you.
You're absolutely right. Thank you.
Thank you. We have concluded comments. Senator Shimizu, go ahead. You're recognized.
I don't know, maybe the previous chair may have not written it down, but I raised my hand. Thank you, Mr. Chairman. Thank you for giving me this opportunity. I've mentioned earlier, at least from Senator Shimizu, the three or four issues that I'm looking at in terms of the budget is really the areas of health. It's very critical. Public safety, education, and then revenue enhancement. I'm glad to hear, that you're looking at revenue enhancement in terms of the fees and so forth. And I think this is like the good senator spoke before me. It's really trying to get the left hand to know what the right hand is doing. So maybe you might just want to, when you have your cabinet members, say, hey, look, Governor, I'm trying to increase my revenue enhancement so that I can at least cover the $558,000 that you have proposed to cut. This is the governor's cuts, right? And earlier I was hearing you, Chief, saying that your personal rating is at 5.
That's my personal.
In terms of that's your personal rating, and you like to see it at 10. But like anything else, we have to equip the soldiers, just like we do with our soldiers on the war on terrorism. We need to be able to equip our Department of Public Safety with the necessary funds to go out in the battle of the streets of crime. And I know that we have our rules of engagement here in the Committee of the Whole, that we will not entertain any increases or restorations of budgets until we finish at least going through all of the agencies, and then from there the good chair will guide us through how we can come up with the budget that will at least I hope it would take into account the issues of health, safety, and education, and of course the revenue enhancement part. But and that's the rules of engagement, Chief, so that you understand why there's no motions, at least as much as I want to go to a higher calling, to say that I do not agree with the governor's cut with our police department, our Guam Police Department. I don't agree with it. Absolutely not. We must equip our people out there, because when we need help, we call our police. And we want to make sure that they are given all the resources that they need. In fact, I think even maybe the criminal element is much more funded than we are. And at that point, if the rules of engagement is not changed and we look at it, I can share this with you, that my inclination will be not to cut the Guam Police Department. Absolutely not. I mean, I tell you, like health, it can only take a moment's incident where people can be maimed for life or lose their life. And you guys are with all the other law enforcement people, like the fire department and corrections and other front line soldiers in the fight against crime. And I see $500,000 is going to be cut from your budget. I hear the chief saying in so many words, you know, I would do my best to try to not have that kind of impact. But you're at number 5, and I want to support you, Chief, to get to that number 10. And I think the people of Guam deserve that. That's $500,000. Maybe I didn't hear it correctly, but you're talking about holding in terms of the 43 recruits, not getting them trained to go out into the field, because like understand, you know, the stress that occurs out there on our police officers, not having enough of the manpower there because of our Guam's call to duty and that war against terrorists. So, Mr. Chair, I wanted to say that, but still within the rules of engagement, because I don't want you to, you know, rule me disorder, because I know you feel the same way. I know you do. But at a very appropriate time, I will rise and do what I have to do at that point in time. So, Chief, I just want to let you know, at least I think I can speak for some of my colleagues on this side of the aisle, that we're very, very concerned, and I'm sure even on the other side of the aisle, that we need to look at those that are actually saving lives, and you guys are the front in that area.
Thank you.
Thank you.
Thank you very much. We've concluded with section 7. Thank you very much, Representative from the Guam Police Department. If the body will permit, the Chief Medical Examiner has explained to me that there is a number of cases that he needs to attend to. As a small office, he's the principal in that office and needs to attend to it. If there are any objections to moving to the Chief Medical Examiner? They're not going anywhere, but he needs to deal with them. Are there any objections to moving directly to the Chief Medical Examiner's office? If there are none, okay, are there any questions then with respect to the Chief Medical Examiner's office? Senator Munya Barnes. Go ahead.
Thank you, Doctor, for being with us this afternoon, half a day. The budget right now, based on fiscal year 2007, specifically shows that your budget's at $408,559.
That's correct.
And the reduction that is proposed based on Bill 74 is $398,345, right?
Yes. Yes, sir. Yes, ma'am.
And that would be a deduction or reduction of what amount? 10,000?
Reduction.
10,214?
I think, yeah, about 200.
Okay, with that 10,214, if it were not to be reduced, what would that 10,000 be utilized for?
Could you repeat the question, please?
You're saying that there's a reduction of 10,000. The proposed reduction is at 10,214. And my question to you is, if that 10,214 were not to be taken away from you or not to be reduced, what would it be used for, utilized for?
Well, I will. That will be part of that will be for a contract with the GMH, because I have a contract with GMH in the maintenance and also utilities.
The contract with the maintenance, who's that contract with?
I have a contract with the GMH.
GMH.
Yeah,
and that
Guam.
maintenance would be for utility work and
Utility, and right now I was telling the senator that I don't even have a air condition in the morgue, so that every time I perform the autopsy, I will be sweating like taking a shower also, So if that amount will be reduced, I will not be able to purchase what I'm planning to.
so it is really important that even if it's a deduction of 10,214, that 10,214 can go a very long way.
Yes, ma'am.
Mr. Chair, again, just based on what some of my colleagues shared when it comes to the health and welfare of our people, Dr. Espinola, you are the only, you are the medical examiner contracted with the Guam Memorial Hospital, am I right?
Not Memorial Hospital, but government of Guam.
For the government of Guam, you are the only one.
I'm the only one.
So if you decided to leave today, would there be anybody to replace you at this present time?
No, ma'am. In fact, with my last contract, the Attorney General's office tried to locate some qualified person, but they were not able to get anybody. So, but I'm willing to stay if they cannot find a replacement.
Mr. Chair, it just leaves me to some concern again based on what Dr. Espinola does, what his mandates are, what his missions are, and he has shared with us his concern about that reduction, and I bring it to the forefront of this committee that we look at that carefully at the end based on what we've talked about and reconsider deleting that reduction. Thank you.
Senator, I have a suggestion. You see, before I came to this island, the military, whenever they have a death in the military, their forensic pathologist from Okinawa comes here. And then later on, they say that it's too expensive to bring their pathologist to Guam. So since then, it's now about 14 years, I've been doing the cases at the military, both Navy and Air Force. And I know it's not in my level to negotiate with the military, but I think since I'm doing the military cases, probably it's reasonable for them to contribute to the Office of the Chief Medical Examiner, so that in that case it will lessen the burden.
Duly noted, Doctor, and we'll definitely take that into account and make sure that we prepare something to work with that effect. I will talk with the chair of Human Services.
Yes, thank you.
Thank you. Any other questions for the doctor? If there are none, thank you very much, Doctor.
Thank you very much for
that. Concludes the Chief Medical Examiner. Let's go ahead and call the Guam the Guam Fire Department in. We are now on Section 8. Are there any questions on Section 8? Okay. Yeah, they're coming in. We'll go ahead and take a break pending the seating of the fire department officials. Okay. May the whole be in recess.
Thank you very much, Mr. Chair. Chief, congratulations.
Thank you, Senator.
The budget here, as outlined, would have paid for the operations of the department. I know you're kind of new coming on board. You're trying to catch up because this was not prepared under your leadership and your tenure. But when we say that we fully fund the operations of the department, what are there any outstanding obligations of the department or programs that the department has that it has not implemented? Whatever training programs, uniform personnel, stipends, if they get stipends, are we all up to date on those operational needs of the department, promotions and things of that nature?
Senator, if you may, I'd like to have my ASO respond to that.
Yes.
Well, Senator, as far as the promotion is concerned, particularly for the fire captain, we have put a hold on that, basically because of the funding concerns.
So promotions are not being funded at the Guam Fire Department for the captain positions?
For the captain's position.
Okay. Any other positions that are not that are up for promotions or have gone through the promotional process, and the status of those?
Senator, aside from the captain's position, we have addressed the fire service specialist as well as the twos, but presently they're all on hold right now.
They're also on hold.
Yes.
Okay. So, and that if this was released, if the cut was not done, would that have resolved that issue, or still would not be sufficient, or to meet that issue?
Repeat the question again.
If your $500,000 cut, which is about $500,000, correct?
Yeah, about 542,000. Yeah.
Right. Where is that going to be taken out of? In other words, if you had that funding, was that funding slated for the promotions? Maybe not specifically, but would that have been used for that purpose?
Oh yes, yeah, yes, Senator.
So that's what it would be. So, again, it's a matter of the priorities. Where we've put these promotions in place even before we decided that our economy was bleak.
Yes.
We funded it. We said we fully funded it. We put it in the budget and so forth. And it just for me, is a little. I'm just frustrated because these individuals and these firefighters have gone through the entire process. We promised them to be promoted. We put the money for them to be promoted into the budget, and now we're asking them to withhold their promotions. And everybody understands that. But when you have the front office promoting their people, and giving pay raises and slotting people into new positions so that they can get a pay raise, it just somehow, when we began this whole process, we were all even. Everybody was even. Now that we're in a bleak picture, some people are still at the place where we were at the beginning, with no sacrifices being asked to make, and we find that our frontline men and women in the public safety department are being asked to step back. And there's the inequity, there's the frustration that we face, and I think that there's where the people, and it's not because these people, we're promoting them just for the sake of promotions. There's been no promotions at all in the fire department in 14 years maybe in the specialist ranks?
Yes.
And yet the front office got a pay raise at the first term. They're getting a pay raise the second term. And that's the frustration we have when we set the policy here and we put it in place, and then it gets held up for one reason or another. We resolve that, and then we say, no, you can't have it because there's not enough money, but we've already put more money in our own pockets. And I think that that's really the frustration I find, and what I wanted to clear up with this. Unfortunately, the rule is we can't make a motion unless we're going to cut some more. So I'll save you the thing. I'm not going to make a motion to cut any more from the fire department. I guess when we come to reconsider that, we'll have to see where all the resources are and how we can try to work this in so that either those that are, if we're going to cut people or ask them to forgo it, then everybody that's gotten more than they should have should also forego and bring us back so that we're all even again making the same sacrifices. Thank you very much, Mr. Chair.
Any other questions or comments from the Guam Fire Department? Senator Palacios?
Thank you, Mr. Chairman. I'll ask the chief. You heard me ask the Guam Police Department regarding military deployment. Do you experience the same problem with your personnel? I know that there are members of the fire department that, of course, helping out on a part-time basis
Certainly,
with the
Senator,
National Guard.
Yes, there is a major impact on that.
I want to ask you, how do you handle this voluntary deployment? People that are not required to go, but they choose to go.
Presently, Senator, to respond to your answer, I am doing a research on that. I want to see what are the conditions in those two categories of deployment with the fire personnel, because I need to address that because it is an impact in our manning power distribution. Presently, we have 82 of our personnel, uniformed personnel, within that.
Do you know how many of that voluntarily deployed themselves?
Presently, Senator, 25 are being deployed right now, and I would say half of that is on a volunteer basis. And I coming into the position that I'm performing right now as an acting fire chief, that is a concern on my part. And I do want to look and will look into that situation.
The other question that I probably would ask you is, you know, in the last legislature, I tried to introduce a bill, an amendment, but it's rejected by the majority. With respect to allowing or permitting assistant fire chiefs to work the 106 hours, even though by the definition and that they are administrative staff, and by testimony from the Department of Labor, Department of Administration also, that they actually are exempted, but because sometimes they are utilized, then they may claim. So what appears to be the case is that this is really internal matter, and I want to ask you because you're the chief and you can do something about this. What is your practice with respect to allowing these people, and this is my own observation, by allowing these people to work just so they can say that they justify charging the people of Guam the extra 26 hours bi-weekly at an average of $25 per hour with, I guess, with an additional income, special income of about $350, $375 every 2 weeks. What is your practice? Because the testimony before this, and this is where you can cut. This is where you can stop because, in my opinion, and I don't think it would affect the life and welfare of the people of Guam because they are on standby. We have police majors, police captain that are subject to on-call, but they don't charge the people of Guam. The assistant fire chief are subject to on-call, but because of that, they charge the people of Guam the extra 26 hours. What is your practice? What is your policy on that issue?
I guess presently that is the practice that's happening right now. But if I do recall back during my first tenure within the organization, that was implemented of the 106 hours, and that is to include all, and the language there is all uniform personnel. And perhaps maybe if we can look into that, and we can maybe change that language there.
I have ready for introduction, in fact, an amendment to this bill to amend that law and include chiefs, deputy fire chiefs, and assistant fire chiefs shall not be eligible. What do you think about that?
Senator, if that bill becomes a law, then it becomes a law.
But would you support such a language?
I'm pretty sure I can.
You know, when you thought of that, it's not much, but it amounts to about $33,000 a year. And when you look at the other section here for the EMTA, for a proposed reduction of $17,382, I say we don't have to reduce that if you're going to just control the unnecessary expense, control the special pay for the fire chiefs, and of course if they're entitled, then by all means we have to pay them.
Yes.
But internally, in my opinion, It can be controlled to the extent that they don't have to work. And so there is the money, and we're going to deal with the firefighters, EMTA duty for a reduction of about 17,000. I don't support that reduction. And I just like to look at both item A and item B, or rather section 8 and section 9 of this, and point that out.
Senator, in agreeing with you, because the certification for the EMT, the uniformed personnel that's required from captains and below, I think those people are deserving on that. And it's only right that the department provides that compensation for their incentive.
You know, latest information on the EMT special payment is that they have not been paid yet. What's the problem?
I think the problem, because the present situation that we're in right now, the austerity program, that's perhaps the reasoning for not compensating.
You know, but this budget was passed into law in October, and it provides for the 695,000 for that special pay. It's actually supposed to be for back pay.
Yes.
Why hasn't been a dollar paid?
If you allow me, Senator, I'd like to have my A, so elaborate on that.
Well, Senator, the allocation of that fund, where the fire department is currently paying the uniform personnel the 15% incentive pay. I think what there's a misconception here. About several years ago, 2 years that the department had frozen the 15% incentive pay. So if the allocation here is meant to be for prior year obligation, we were basically instructed to apply the prior year obligation.
That's what I mean.
Yeah. And what we did was continue the 15% incentive pay using the funding available.
Okay, that's it for now, Mr. Chairman. Thank you.
Senator Guthrie's, and then Senator Wanpan.
Thank you, Mr. Chairman, colleagues, and ladies and gentlemen from the Guam Fire Department. Now, we have with us the acting chief. Is that correct?
Yes, Senator.
And how many acting chiefs have we had since 2003?
Recalling the number of acting capacity chiefs, I can surely count 3.
3 or more, right?
Yes.
And sometimes the same people more than once, right?
Yes.
Okay. Can you please explain to us why we do not have a permanent fire chief? What is happening with reference to the governor nominating someone to be the permanent fire chief, and the reluctance of our fire personnel to assume the permanent position of fire chief?
Based on myself, on my experience before I retired the first time, Senator, I can safely say that the reason why these folks, the previous acting chiefs that were in place, because they're not ready to retire, they have not met the number of years to retire, and the other is it's not a classified position for them. But that's where I can safely explain that question, is that they're not ready to retire and they're not classified. It's not a classified position.
Could it also be a financial reason that the pay of a uniformed senior fire department officer, with the added monies that Senator Palacio spoke about, is almost comparable, if not exceeding, the pay for the appointed fire chief?
I can agree with that, Senator, that it's their present rank, not being on the fire chief position, they are earning more compensation with their present rank.
Okay. Now, in your case, you indicated that you had retired.
Yes, ma'am.
And you retired from the Guam Fire Department. What year was that?
1999.
1999.
Yes, ma'am.
And was it a case where the governor asked you to come on as the acting chief?
Yes, Senator.
So you were not at the department when the governor asked you to become the acting chief?
No, Senator.
Okay. So now you're serving as the acting chief.
Yes.
Did you have to forego your retirement pay to be the acting chief?
Yes, ma'am. I had to cancel my retirement.
Okay. Was it a financial loss or gain?
Loss.
That's what I thought. See, what I'm trying to get at, Chief, is we have some kind of a structural compensation problem at the Guam Fire Department, in some ways even at the Guam Police Department, where there really is not an incentive for our most senior fire officers to take on the responsibility of becoming the permanent fire chief because of financial losses that they will incur under the present salary system and the unknowns that come with the position. Now, even in your case, in a way, you were penalized for taking this on. Is that correct? Because you had to forego your retirement pay.
Yes.
Correct. And that